earth-shattering about this. It is not hard, and I'm going to try to make it even easier for you to remember. You guys are focused on the test, most likely, because that's what's in your horizon, right? You're, oh my gosh, there's a big test. I have to perform. I have to answer questions, and I can't start my career if I don't get past the test. Big stress. I get it. But good morning, Fatau. But I am not focused on the test. I am focused on the day after the test. When you actually have to go to work and do these tasks on real, live, breathing people, if you just focus on the test, you're kind of missing the point. So my goal is to get you to a place beyond the test. Now, by doing that, if I do my job right, that test becomes super easy for you. Good? That's my hardest job. Did we have another comment, Jake, that I missed?
Good morning.
Okay, all right. So good morning, all. Thank you guys for joining. All right, so this is your class, not mine. I am just here to facilitate it. It is your class. So please, if you have questions, ask them. I encourage questions. Chances are, though, because I've been doing this for 17 years, chances are I've already answered your question and it's coming up. So usually when you ask a question, I'll say, yep, we're getting there. Just 1 second, because you're a half a step ahead of me. So usually I'll say, yep, we're getting there. But most of the time, I'll try to give you at least an abbreviated answer to satisfy your curiosity before we move on. But it is your class. This class does meet on Mondays and Wednesdays from 9 to 1 for 4 weeks. The first 2 weeks, I am going to talk nonstop from 9 to 1. There's no practice in the first 2 weeks. I have way too much to teach you, to go over. Starting on week 3, we'll have a little bit of time at the end of each class for practice. Week 4, we have a little more time. As the program progresses, you get more practice because you have more knowledge under your belt. But in reality, you're going to have to do some of your practice at home for best results. So keep that in mind. I'm going to give you a ton of tools that will help you practice at home so you're practicing the right way rather than just you know, when you went to school, did you ever try to learn something new and then they sent you home and said, yeah, go practice? And you got home, you're like, I don't know if I'm doing it right. You know, so practice doesn't really help if you don't have a high level of confidence in what you're doing, because you might be practicing the wrong things and learning the wrong muscle memory. So I don't want you to do that. I don't want you to just go practice something. We're going to give you very targeted tools to use while you're practicing to make sure that you're always performing the skill correctly. Good? Make sense? I'm going to be there with you every step of the way, and we are going to make this truly easy. As long as you know your name, we can start. So speaking of names, let me tell you who I am. My name is Patricia Laramie. I am a registered nurse. I have been teaching this class for 17 years, and we're way bigger than we look, right? We're in this very small room, right? We are the #1 CNA training channel on YouTube. My book, the one in front of you, the Spiral book, is used by multiple schools across the country. It is the #3 CNA training book used by schools. And because I've developed all of this, I am a subject matter expert in Prometric testing, which is the agency that's going to be testing you. So I'm going to help demystify the test for you as well, okay? I've created this program. It's way different than it started. 17 years ago, this program did not look like it does now. It just didn't. But over the years, I've learned a lot, and I've learned how to present the information in a way that builds. So today we're going to learn some very foundational stuff. And then the next class, we're going to build on that. So if you don't get today's lecture, it's going to be hard for you to keep up on Wednesday. I always say that this class, the first class, is the most important class. It's the one that I really don't want you to sleep through. The rest of them, we can kind of work with, but this one is the most important because if you don't get a good foundation, what comes next isn't going to make much sense. Does that make sense? Okay. So Mondays and Wednesdays, we're going to go over the books that you have in front of you in a little while. We're going to go over the syllabus, which tells us how we're going to get from point A to point B in a little while. But before we do that, I've got to give you some information so that you know where we are and where we're going with this. Remember that you can attend virtually. Wrap-up emails are sent. Don't pay attention to that. I got to change it. Wrap-up emails are sent at the end of every class because I'm going to go over a lot of information with you. Like I said, I'm going to talk nonstop for 4 hours. So at the end of the class, I'm going to send you an email with links to everything that we talked about. And it will help you put into practice what we're learning. So how many of you got my email yesterday? Everybody got my email? Okay. I saw your response. Most of you guys responded, so thank you so much. If for some reason you don't get the wrap-up email, and that's why I have you do that, because when you respond to me, it tells your email provider, hey, this is okay. It's a way of whitelisting us in your email. Otherwise, we end up in spam. So that's why I have you send me something says that you got it. You're going to get a wrap-up email. If for some reason you don't get those emails, please let me know the next class so that we can troubleshoot it and make sure that you are getting that email. Because we send them out as what we call a broadcast, so they go out to all of you at the same time, which can mark us as spam because it's to more than one person. Good morning. Please, I wanted to know if we're supposed to put the bedpan on the client's table before using. Good question, Peace. We're not there yet in this class, but let me answer your question because you're probably getting ready to test soon. So number one, bedpans should not be put on directly on a table. If you're going to put a bedpan on a table, put a barrier there first, but you don't need to. You can actually leave the bedpan in the bottom drawer until you're ready to use it. But don't just, remember this is a dining room table, eating surface, so don't just put a bedpan directly on the table. Okay. And Adriana says, Miss Patty, good morning. I want to thank you. I had my test on 3-7 and passed. Thank you. Congratulations. Awesome job. Good morning. I passed my test 314. Pi Day. Thank you so much. Watched all your videos in New York. Congratulations, Zana. Great job. Awesome. Okay. Oh. Thumbs down. No, thumbs up. All right. So you're going to get a wrap-up email after each class. And today you're going to get another email as well. So today you're going to get 2 emails from us. One of them will be the wrap-up email. But the second one is going to be your enrollment in our online course. We're going to talk a little bit more about the online course later. But that online course helps you put into practice what you're actually learning. It's interactive. It has you do things that will help cement what we're going over. So you'll get enrolled in that a little bit later. You can do it while you're in the program. That's fine. You can do it after you graduate before you test. That's fine. Students seem to do better if they kind of go along with the program and accessing those lessons. But however you want to address it is fine. All right. So what happened here? Okay, this book, hold on. This book, the CNA Skills Study Guide, is what we're primarily going to be working out of in class. The spiral book. This is your book. You can write in it. You can highlight it. You can color it. You can eBay it. It's yours. It's the one that we're going to work out of in class. We're going to do some activities in here in just a few minutes, so you can write in this. But it's also important because this book has all of the notes for everything I'm going to talk about. So you don't have to take notes in this class. I've done all that for you. And I'm going to show you where to find it for every lesson that we go over. You're going to see a page that looks like this at the beginning of the lesson as I start to talk. It's going to tell you what page to go to follow along with what I'm talking about in class. I'm very detailed. I'm also very organized in the way that I teach this. I'm not organized on my desk at home. Don't look at that. But I'm organized in the way that I present this information. So you'll always see a page like this that tells you what page to go to and an overview of the topic that we're going to be covering. So go ahead and turn in this book to page 17. Betty says, hi, everyone. I'm taking my state exam test tomorrow. Please be in prayer with me. Great vibes out to you, Betty. We know you're going to do fantastic. But stick around because this next 45 minutes is going to be super important for you to know before you take the test, because it's kind of the key to passing. So the key to passing the test, I'm going to give you hour one, day one. So stay tuned. So if you go to page 17, you're going to see a page that looks like this. This matches what we have on the back wall. This very first banner back here is what you see up here. You are going to learn everything on that back wall in the next 2 weeks, but you're not going to memorize it. Memorization doesn't do you any good. Doesn't help you a bit. Because when you memorize something, it will eventually fade from memory. Remember I told you that I am training you for the day after the test when you go to work? If you memorize something for class, when you get out there to work, you won't apply it because you memorized it, you didn't learn it. There's a difference there. Well, guys, one day I'm going to be the body in the bed. I'm getting old. I am going to be the body in the bed. So I need you to learn this information so that you can apply it to me when I'm the patient. Okay? Does that make sense? So the very first thing we have to learn is, well, what tasks are we going to have to do? How do we do those tasks? How do we get our information? What is our role as a CNA? So that's what we're going to focus on now. And we're going to learn something called skill rules as we go. So this is learning, not memorizing. And this is going to apply to every single skill that we learn. So this page, this is an overview page. It tells you the skill or the principle we're learning, which skills are involved in that principle. This tells you I have a video on this, which you can watch. I'll tell you where to find that in just a little bit. You can watch this video on your own, but here in class, we're going to watch this video together first. And then it's going to apply to the principles, and we're going to get into this in a little bit. But this gives you an overview of the topic we're about to cover. And page 18 is the actual notes from the video that we're about to watch. Like I said, you don't even have to take notes. So what we're about to watch is a video that's going to cover a concept called ADLs. And I want to explain this before I show you the video, because this is the part that tends to get most students a little bit messed up. When you got up this morning, before you came here, you woke up. What did you do after you woke up? Before you can get ready, what did you do? Before you went to the bathroom, what'd you do? Got out of bed. Absolutely. That's the first thing that you did. Otherwise, you'd still be laying in bed, right? You wouldn't be here. So you got out of bed and you went to the bathroom and you got ready. So what kind of things did you do to get ready? Okay. So bathing, grooming. I'm assuming you all dressed because you're not wearing what you wore to bed last night. Right? So bathing, dressing, grooming. What about eating? Okay. Or drinking, drink coffee. Yeah. Okay. So we did a lot of things ourselves. Did you guys need help with any of those things? No, you did them all by yourself. How long have you been doing that stuff by yourself? Yeah, since you were able to, right? Since you were physically able to do those things by yourself. How long do you plan on continuing to do those things by yourself? Ah, there it is. Say it loud. Until you're no longer able to. So that means that you will continue brushing your own teeth until you physically cannot do that anymore. You will continue toileting yourself until you can physically no longer do that for yourself. And the goal is to get you all the way through your life without needing any help with any of it, right? That's the goal. That's what everybody wants. Nobody wants somebody to help them with toileting. Nobody wants to be fed. You want to keep doing those things yourself. But what if you woke up tomorrow morning and mysteriously both of your arms totally not working? They're just laying there, lumps of flesh, not moving a bit. Now, clearly something is wrong. And you might be able to get yourself up out of bed, but you might struggle, like really struggle more than you think you would. So tonight, when you go lay down, I want you to lay in bed and think about what I just said. And I want you to try to get up out of bed without moving your arms. It's harder than you think. Okay. But are you going to be able to toilet yourself? You can't pull your pants off if your arms aren't working. You can't wipe yourself either. Are you going to be able to brush your own teeth? Are you going to be able to bathe yourself? Groom, dress, feed, coffee? Oh, you need a whole lot of help, right? So understand that you might be independent right now, but we are all one small step away from needing help. Do you guys understand that? That's big, right? So as long as you can, you will. But if you can't, now we need some help. So the first person you're probably going to call is mom, right? Moms are always there for everything. Hey, mom, my arms don't work. I need some help. Come help me. You know, we're somewhat comfortable with moms hanging out and helping. Still not happy about it, but we're a little more comfortable. Now, if there is no mom, for whatever reason, now we got to cast our net out a little further. We got to find somebody that we're willing to ask for help. Now, this might be a partner or spouse. It might be an adult child, but it's someone that's very close to you in your circle, right? Might be a sibling, but it's someone that you have a high level of confidence in. But what if there wasn't a close family member that you could turn to? Now you're casting your net out a little wider and you're thinking, oh, maybe a good friend? They got to be a really good friend to help you with some of these things, right? Now, I'm lucky. I have a really good friend that I could call on to help me with some of these things. I wouldn't like it, but I got somebody I could. But what if I didn't? No mom, no significant other, no close friend. Now we're into uncharted territory. My arms don't work, but I need help. And that is where a CNA performs. We are going to help stable patients with routine tasks, things they would be doing for themselves if they were able to. Now, there's a lot of reasons that a patient may not be able to do something on their own. Maybe they're weak. Maybe they're sick and don't have the energy. Maybe they're broken in some way. Okay, a fracture, paralysis, things aren't working the way they're supposed to. There's a lot of reasons that would cause somebody to need our help. But just because they need our help doesn't mean they need all help. If somebody can, they will. Remember that? Somebody can, they will. So if I've got somebody that needs help to the bathroom but can brush their own teeth, do you think I'd be brushing their teeth? No, because if they can, they will. Make sense? So we are going to help stable patients with routine tasks that they would normally do themselves, but for some reason can't. And we're only going to help them with the things they need help with, not all tasks for all patients. Good? That is the definition of a CNA. We help routine or stable patients with routine tasks. But we have to know which tasks to help which patients with, because we're not doing everything on all patients. And that's what I'm going to show you now. How do we figure out what tasks to do on which patients and how to modify those tasks based on what this particular patient needs? That's what we're going to focus on now. So a big part of what CNAs do are called ADLs. This is what we just defined. Activities of daily living. Getting up, mobility, toileting, bathing, grooming, dressing, feeding, socializing. That's actually a daily activity. Rest, and other mobility tasks would all be activities of daily living. So this is predominantly what we're going to help patients with. It's not all we're going to do, but this is predominantly where CNAs function the most. And I'm going to show you a video that's going to walk you through this, and then we're going to talk about it after the video. So Jake, you want to go ahead and mute me and then put the video on?
The Care Plan and the CNA, why it's always about the care plan. A presentation brought to you by 4YourCNA.com. Thank you for joining 4YourCNA's online CNA test prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA test prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job, because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the Activities of Daily Living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone, but we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs: bedpan or catheter. I also know she is at risk for constipation. Since she's not moving much and she's on pain medication, this is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes. And they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days. And she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure.
Yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report. It may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job! For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
Okay. So do you guys understand how CNAs know what to do? We follow the care plan. Do you do anything, or if it's not on the care plan, should we do it? No. What if the care plan tells us to do something, but we can't for any reason? Yeah, we let the nurse know. So that is the scope of practice of a CNA. That's it. That is it. You now honestly know everything you need to know to pass the test. I'm going to show you how to do the skills. We're going to talk about accommodations that we need to make for certain situations. But ultimately, CNAs follow the care plan. If you can't follow the care plan, you notify the nurse. It's really that simple. That is the scope of practice of a CNA. Now, if you're not doing one of those two things, following the care plan or letting the nurse know why you can't, you are outside of your scope of practice. So how hard can the test be? Yeah, it's not hard. As long as you know that CNAs follow the care plan. If we can't follow the care plan, we notify the nurse. Good morning. There's the books are over there, and your t-shirt is on the front table. You're welcome. So let's see if we truly understand this process. This is the care planning process that you just saw in that video. The RN assesses the patient. So as the RN, that's my role. When this patient gets brought into our facility as the RN, I'm going to look for all real problems and all potential problems. And I'm going to develop a plan for everybody to follow so we're all on the same page. Now, if I go in and I assess this patient head to toe, and I got some ideas, but I don't write them down, the next nurse that comes along will probably have some different ideas. If they don't write it down, the next one that comes along will probably have some different ideas. And do you think this patient is going to get consistent care? No. So we have to have a plan in place. So the RN assesses the patient, looks for real and potential problem, and then we develop a care plan. Now, this care plan isn't just for CNAs. It's also for nurses and dietary and physical therapy and discharge planning and social services. Everybody is involved in this process. But one of the things that the care plan is going to do is give you tasks that need to be performed. While you're doing those tasks, you should be making observations. Now, it might be something that looks strange, smells funny, sounds unusual, feels off. We're going to use our senses to figure this out, but we're going to make observations. When we make those observations, we're going to report those to the nurse. And that's going to cause the nurse to check into it a little more and to do another assessment, which will probably change the care plan and give us some different tasks to do. While we do those tasks, we need to be making more observations. And this just keeps going round and round and round. Now, hopefully at the end of all this, we're spitting out a healthier patient. That would be nice. Doesn't always go that way, but it would be nice. Sometimes at the end of all this, we spit out a not healthier patient. We can't fix everything, unfortunately, in healthcare. So that outcome does happen, but our goal is to try to avoid it. Now, if everybody here is working up to their full potential, that patient has a much better chance of surviving. But if we're broken down somewhere in here, ultimately, who's that going to affect? The patient. Now, this is super important for you to understand because in some of your workplaces, you are going to find that it's CNAs versus the nurses. And there's a lot of headbutting, power struggles between CNAs and the nurses. Now, sometimes this is because the nurses don't write good care plans. They don't take good care of their patients. They're not making good assessments. They're not looking for real and potential problems are where we really have need to put more emphasis, okay? So sometimes it's the fact that the nurse just isn't being a good nurse. I wish I could tell you they're all good. They're not. But sometimes it's the CNA not understanding their role. And they start to make decisions. And when CNAs make decisions, they are making decisions with incomplete information. And who's that going to put at risk? The patient. So this process is designed specifically for the best patient outcomes. If you find yourself in a situation where it's you versus the nurse, the person that will always lose is the patient. Always. So if you find yourself in that type of a situation and that type of a scenario, you need to get out because you're not doing your patients any help. You're not doing them any good. So switch to another shift, switch to another hallway, switch to another work environment, but don't stay in a place where it's you versus the nurse. And you've got to be able to do some self-reflection to figure out, is this problem a me problem or is it the nurse? If it's a you problem, then we can take some steps to overcome that. If it's a nurse problem, find a new place, because you're not going to do that patient any good. Does that make sense? Good? Okay. All right, so let's do an activity to see whether we really do understand this topic. So if you go to page 20, you can write in this book, over the next 10 minutes, I would like you to answer these 8 questions. So there's pens on the table in front of you. But take about 10 minutes and answer these 8 questions. When you're done answering the questions, I'd like you to put your pen down so I know who's still working. Those of you who are joining us virtually, you can find this on page 20 of the CNA Skills Study Guide. If you don't have the CNA Skills Study Guide, we'll put the ordering link on the screen for you. While you guys are finishing up, I got right into teaching and I forgot to tell you a few things, housekeeping tips. Bathroom is the last door on the right. Fire marshal says I have to tell you that your exit is there. Why I have to tell you that, I don't know. We also have a back door. Just unlock it, go straight out the back. You can eat and drink in this room. There's no problem. We will have a snack break in somewhere around 10:30-ish. There is coffee back there, Keurig. You help yourself. There's creamer in the fridge. There's snacks back there. All of that is available to you at no charge, so feel free. Just the only thing that we ask is that you not put liquids in the trash. Make sure you dump your liquids out before you put them in the trash. Other than that, we're pretty easy. Okay, we will take a break around 10:30. So everybody good? Let's go over some of these questions really quickly. You receive the displayed care plan. How far will you walk the patient? Easy answer. Easy answer. Say it louder. 10 steps. Why? Yeah, because the care plan says easy answer. What is required to assist this patient to stand? How do we know that? The care plan told us. Now, what if we go to lift that patient up and they seem a little unsteady, a little weak? Can we just go grab a walker? What do you guys think? Why? Okay, even easier answer. Okay, even easier answer. It's not in the care plan. So we follow the care plan, the whole care plan, and nothing but the care plan. So if that care plan does not tell us we can use a walker, can we use a walker? And the reason is it's not in the care plan. Are you starting to see the correlation there? Okay. Easy answer is always care plan. Care plan. Care plan. So let's go to number 3. You receive the displayed care plan. Which body part are you going to exercise? Why? Care plan. Okay, but exercise is good for us. We all know that we're supposed to be exercising. It helps with circulation. It helps with digestion. It helps with cognition. It helps with everything. Exercise is good. So why can't I go in and exercise all the joints the patient does not move on his own? There it is. It's not in the care plan. So even though we know exercise is good, if the care plan doesn't say it, can we do it? No. There's a reason that the nurse does not want you exercising those other body parts. Maybe one of them has a blood clot in it. And when you start moving that extremity around, you can dislodge the blood clot and kill the patient. That would not be good, would it? So we follow the care plan, the whole care plan, and nothing but the care plan. How many repetitions are we going to perform? 3, because the care plan told us to. Number 5, what is the safety concern for this patient? Okay, they're in an inappropriate position. How do I know that? Yeah, well, most care plans aren't going to tell you that. They're going to rely on your eyes. This one, because it's in the care plan, we know it's a safety concern. Most care plans aren't going to tell you that. We'll get there in a little bit. Is documentation required for this skill? Okay, let's stop there for just a second. Time out. How many of you guys want to pass the test? Okay. And what do we know about CNAs? How do we know what to do as CNAs? Care plan, right? So we have the care plan and we want to pass a test. You think those two things have anything to do with one another? CNAs have to follow the care plan and we want to pass the test. Do those things have anything to do with one another? Okay. So if you want to pass the test, you have to follow the care plan. And when I say follow the care plan, I mean you need to be religious about it. You need to follow the care plan. So if this care plan tells us documentation is required and it's part of the care plan and you want to pass the test, what do you think you need to do during this skill? Follow the care plan, which will include documentation. Do you guys see how that's important? A lot of people take the test and they forget to write something down. They measure a pulse and they forget to write it down. It happens. But then they complain. I can't believe they failed me. I just missed one step. You did not fail because you missed one step. You failed because you didn't follow the care plan. Do you see that shift, that difference? It's not about the steps. It's about the care plan. Are you sick of hearing care plan yet? We're going to keep going. We're not done. All right, so go to 7. You receive the displayed care plan. What vital signs are you required to obtain? Pulse. Is that it? You can't do them all while you're in there? No, because it doesn't say it on the care plan. Very good. And how long do we have to count for? Why? Care plan. Okay, it is now almost 10 o'clock, and I am absolutely serious when I say that you have all the information you need to pass the state exam. They are going to give you care plans. What are you going to do with those care plans? Follow them. Are you going to leave anything out? You're going to add anything in? You will pass the test knowing that. It is that simple. They give you a care plan. You follow that care plan, and as long as you follow the care plan, you will pass. Now, why is that? Because in a clinical setting, the care plan is what's going to determine whether the patient lives or dies. It is that important. So we need you to understand how important that is and learn here to start to follow it. The care or the test is all about figuring out, do you understand this? That's what the test is testing you on. If they could get away with it, they would give you a care plan that told you to stand on one arm or one leg and pat your head with your right arm just to see if you would follow the care plan. Anybody ever play Simon Says growing up? This is a giant game of Simon Says. But it says Simon, it's the care plan. Make sense? You literally have the information you need to pass. Now, we're going to build on this. This isn't where we're going to stop. We're going to keep going. But if you don't have this, nothing else I tell you is going to make sense. You'll have a million what-if questions. Well, what if the patient can't stand up? What if the patient can't eat? What if the patient this? What if the patient that? And I'm always going to refer you back to the care plan, because the care plan is written for that patient. If I give you an answer, it means absolutely nothing because I'm not giving you an answer for that patient. In order to get information about that patient, you have to go to their care plan. Good? Make sense? That truly is the key. It seems so simple, doesn't it? Now, this is where the problem comes in. And this is why I created this program. In your yellow book, I want you to turn to the index of your yellow book, the very last pages in the yellow book, where it lists all of the words used in the book. And I want you to look up care plan. Now, we know the care plan is super important, isn't it? It's our Bible. It's what we follow. So this book should be nothing but the care plan, right? How many pages is the care plan mentioned on? 2, and they're right next to each other. So this book mentions the care plan twice. Twice. Out of all 200 and something pages, it is only mentioned twice. Now, this is the number 2 textbook used in all CNA programs. And the care plan is only mentioned twice. So that means that out there are a whole lot of CNAs that have no idea what a care plan is or that they're supposed to be following it. Now, to you, this is a no-brainer because of the way I've taught you. CNAs follow the care plan, the whole care plan, and nothing but the care plan. And that is not the last time you're going to hear me say that. This is a no-brainer for you. But I need you to understand that that is not how most CNA programs are taught. They show you how to do the skills, but they don't draw a correlation between the care plan and the test. And they're missing the most fundamental part of being a CNA. So we are going to focus in this class on the care plan, because that's what's going to make you a good CNA on the day after the test. That's what's going to keep me alive when I'm the body in the bed. Good? So this yellow book, we're not going to work out of this one in class. You're going to take it home. You're going to read it. That's your homework. It's got some information in it that I'm not going to go over in class. So you're going to take it home and read it. But that is not the book we're going to work out of. We are going to work out of my book, which emphasizes the care plan. So if you want to know the big difference between the two, my book is going to get you ready for the real world. Okay, good. Questions? If there's a discrepancy between the two books, always go with the spiral book, my book. All right. So if we understand that our job is to read and follow the care plan, and it's going to give us the information we need to successfully perform the skills, and we know that the test is going to involve us reading and following the care plan, wouldn't it be nice to have the care plans from the test? Wouldn't that be helpful? Wouldn't that be helpful to have the care plans from the test? These are 4 of them. These are the actual care plans that you will get on the state exam if you get one of those 4 skills. Now, there's 20 skills that you might possibly get. There's 4 of them right here. Would you like the rest of them? Turn to page 25. Page 25 has all, tells you about the care plans. Has all of the care plans on it. Page 24 will go over how each one of these testing care plans is set up. Now, every testing care plan is going to have a very specific, let me get in there. Let me get in there real quick. Hold on, guys. Technical difficulties. That's okay.
Was the format on the slide off?
Mm-hmm. I don't remember where I was. There we go. All right, page 25. So each one of these are the actual testing care plans. When you go to take a test, you're going to get one of these 11. You're going to. Now, each one of these has one ADL skill. Remember, ADL is something you do for yourself every day. One mobility skill and one documentation skill. So every one of these clipboards has one skill from each of those categories. You don't need to know that, but it's kind of nice to demystify the test a little. So this is how the care plans are divided up for the test. So if you look at this one here, you'll see that we're going to feed a resident who's in a chair. We are going to provide hand and nail care and ambulate a resident using a gait belt. Those are the 3 skills that we are assigned to do. And below each one is the actual care plan from the test. It tells you how to do those skills. So that means when you get to the test, there are no surprises. You know exactly, if you get ambulate with a gait belt, you know exactly what that care plan is going to ask you to do. You know the level of ability of the patient because you learned it here. You know what aids you're going to need because you read the care plan. So there will be no surprises for the test. That helps. That helps reduce anxiety because they can't throw you curveballs. Every care plan is pre-selected. Good? Questions? Now, you don't get to pick your skills. They're assigned to you. Just like in a clinical setting. If you go to work somewhere, you don't get to pick what skills you're going to do on patients. You get a patient, and the care plan is going to tell you what skills that they need. So this is just like a clinical setting. there really isn't much difference between testing and real life. Testing, we follow care plans. Real life, we follow care plans. Testing tells us what accommodations to make for the patient. Real life, the care plan will tell us what accommodations to make for the patient. There's not much difference. Good? Okay. So those are your testing care plans. In here, we have this. You have them in your book, but in here, we also have this. This is a testing care plan set, just like what you have in your book. You've got 11 of them on page 25. There's 11 here. But on the back of this is our classroom copy. On the back of this are the actual checklists that are going to be used during grading. This is exactly how you're going to be graded, step by step. Now, a question I'm going to get asked from a lot of you is, well, how many of those can I miss and still pass? Because everybody wants to know how many you can miss, and it's not that simple. Now, the reason it's not that simple is because each step is going to be weighted differently. Let me give you an example. Let's say that we have this patient here, and we have to brush her teeth. That is our skill that we have to demonstrate on the care plan. Is she in a safe position to brush her teeth? Why? She can choke. Technical term for that is called aspirate. Breathing food or fluids into the lungs is called aspiration, but we call it choking. So this is not a safe position. We probably should not brush her teeth in this position, and we should all know that this isn't a safe position. We don't need a care plan to tell us that. So what would we have to do to get her into a safe position? Yeah, get her to sit on the side of the bed, get her to sit up by lifting the head of the bed. I mean, we got a couple options here. Care plan will help us out with that if there's a restriction. If not, put the head of the bed up. But we got to get her sitting up. If we don't, there's a serious potential impact on the patient. We could kill them. Now, I don't know about you. Has anybody in here ever brushed your teeth? You're somewhat familiar with the process, I'm sure, right? When we brush our teeth, we usually are standing over a sink. And we're not just standing over a sink, we're actually bent forward a little bit. We're not sitting like this, brushing our teeth. Because if we did, we get this big foamy mess, it would fall on our clothing, and we don't want that. So we bend forward a little bit, right? Brush our teeth. That way, all the foam falls into the sink. That's where foam goes. The problem is that if we put the head of the bed up with this person, she is not leaning forward. She's kind of sitting up straight, or even might be leaning back a little bit, which means all of that foam is probably going to go on her clothing. Now, we can put a towel there to help keep her from becoming a foamy mess while we're brushing her teeth. Has anyone ever died from getting toothpaste on their clothes? So if we forget the towel, I'm not going to kill them. But if we forget to put the head of the bed up, could kill them. Those two steps are not equal, and they're not graded equally. They're going to be graded based on the impact that not doing that step has on the patient. So there's your second key to passing the state exam. The test is not about you. It is not about the steps. It is not about how well you remember the steps. The second key to the test is that it's all about the patient. Every one of these checkpoints has to do with the patient. That's right. So if you're focused on the steps, you've missed the point. During the test, where should you be focusing on? The patient. If you're looking at them, Oh, they're really close to the edge of the bed. Is that something that should be addressed? Sure, that's safety. If we're looking at the patient at the end of the skill and she looks like that, does she look comfortable? No. She is not dressed for company, is she? She is not covered with anything, is she? She is laying down, which is a vulnerable position. You think she's comfortable psychologically? There's a safety problem here. Now, if you forget to pull the sheet up, it's not that you forgot to pull the sheet up, it's that you didn't look at the patient, because anybody with eyes that looks at this says, that might be a little off. It's not about you, it's about the patient. Does that make sense? Okay, so the first key to passing the test is follow the care plan. The second key to passing the test is to remember that the test is grading us, but it's all about the patient during the test. Good? Easy, right? Easy. All right. So let's talk about your scope of practice. The notes for this are on page 22 for you. And this really is summed up by follow the care plan. But this lesson gives you some very real world examples about why not following the care plan can be detrimental to the patient. So let's look at the first one there. Care plan tells us the patient must remain upright from 7 a.m. to 9 a.m. every morning. So that's our care plan. They have to be sitting up between 7 and 9 every morning. Well, this particular day at 8:15, this patient hits call light and says, can you help me back to bed? My back really hurts. Now, I don't see anything wrong with that, right? Let's put her back to bed. Her back really hurts. So the CNA gets her out of the chair and puts her back to bed because the patient asked to be put back to bed. But is that a problem? Why? It's not in the care plan. And what we don't know about this situation, see, with CNAs, it's always what we don't know that's going to get us into trouble. What we don't know is this patient is on a medication that if they lay down, that medication will go up into their esophagus and it actually eats their esophagus. It'll eat a hole right through their esophagus. So when this patient takes this medication, they've got to remain upright so that that medication goes directly into the stomach and then into the small intestine without causing issues in the delicate mucosa of the esophagus or stomach. Good? So by us just following what the patient asked for, we put the patient at risk. It's always what we don't know that gets us into trouble. Let's go to this one over here in the second column. It says, the care plan asks us to provide feeding assistance with all meals. The patient refuses to eat breakfast and lunch and appears more confused. But the CNA doesn't report these changes to the nurse. Just figures all old people are confused. And clearly she's old because she has to be fed. So doesn't report that to the nurse. Why is that a problem? Why should we report that? Right, because the patient needs further assessment. It's a change. Remember that whole care planning process we talked about? I said if it doesn't work right, the whole process breaks down. So this is the third thing we have to remember about being a CNA. Number one, follow the care plan. Number two, it's always about the patient. But the third thing is that we have to report everything, no matter how minor it seems to us, to the nurse. because it could impact the patient. It could mean something bigger. Remember, CNAs always get in more trouble because of what they don't know. This is an example of that. And a lot of things don't get reported by CNAs because they assume it doesn't mean anything. Give you a good example of that. Actually, this patient has got a urinary tract infection, and not eating and sudden confusion are the first two signs of a UTI in an older person. Older people don't get burning frequency and urgency like you do when you're young. It's confusion and lack of appetite. Well, if you just assume all old people are confused, you'll miss this. You'll miss it. So those are the three things. If you just remember nothing else but those three things, follow the care plan, focus on the patient, and report anything that is different, any change. That is what separates good CNAs from caregivers. There is a difference. Have you ever heard other terms like home health aide or patient care assistant or patient care tech? Have you ever heard all those terms? There's also nurse techs, there's personal service attendant. I mean, there's lots and lots of terms out there. And at first glance, it looks like they all do the same thing. And for the most part, they do, right? Home health aide can give a bed bath. So can a CNA. So can a patient care tech. So what's the difference? The difference between a CNA and all the others, I call it the alphabet soup, all the other alphabet soup, is that as a CNA, there is only one setting that requires you to have your CNA to work. One setting. And that's a nursing home. Legally, the only place that you are required to be a CNA is to work in a nursing home. Home health, too, if you don't have something else, like a home health aide, right? You got to have something to work in home health because you're unsupervised. But most of the time, they'll just give you a test to be a home health aide for their, company, and it's not a big deal. The big legal part of this I need you to understand is that CNAs have to be licensed to work in nursing homes. Now, it's not about what you do. Has nothing to do with ambulating, feeding, partial bed bath, range of motion. Has nothing to do with the skills. Anybody can do those skills. You can do those skills on your neighbor right now. If your neighbor called you up and said, hey, I need help getting off the toilet, you would go over and help them. You don't need a particular skill set to help somebody brush their teeth. It's not about the skills. CNAs are trained to observe and report. That's what sets you apart from all the other alphabet soup. You are trained to observe and report. That is the difference between a CNA and everybody else. Now, hospitals are like, yeah, we want somebody that's trained to observe and report, so we'll hire CNAs. Pediatric daycares are like, yeah, we want somebody that's trained to observe and report, so we'll hire CNAs. Mental health is like, hey, that might be a useful skill. We'll hire CNAs. But along the way, they might find somebody that's very well qualified, but just never took the test. And remember, the only place that you have to be certified to work is in a nursing home. So they hire you, okay? You know how to do all the things, but you didn't go get your CNA. Now, we can't call her a CNA because she never took the test. She is not a CNA. She might do all the things, but she's not a CNA until she takes the test. So I can't call you a CNA. Well, what can I call you? Patient care tech, patient care assistant, nurse tech, personal service attendant. I can call you anything I want to. I'll make up some words. And we're going to call you that because I can't call you a CNA unless you took the test. That's the difference. Observation and reporting. Once you take the test and you are a CNA, you have a duty to report all observations to the nurse. That's the one thing that sets you apart. If you aren't making observations, you're not functioning as a CNA. Make sense? Okay. All right. So when we're talking about our scope of practice, we have to talk about this. Now you see this up here on the wall. You guys may not be able to see it very well. It's also on the bottom of each one of my banners. This is the Happy CNA place. This is your scope of practice right here. As long as you're inside this house, you are safe because the nurse takes all responsibility for patients. 100% of liability falls on the nurse as long as the CNAs assisting the nurse are working within their scope of practice. So what is our scope of practice? Well, the foundation of the scope of practice is that we follow the care plan, the whole care plan, and nothing but the care plan. What keeps us in line firmly inside our guardrails is that CNAs do normal. Remember, what we do is routine tasks on stable patients according to the care plan. That's normal. We are not doing tasks on patients that are crashing. Not our job. We are not doing tasks on patients that have a blood pressure of 300 over 240. That's not us. That's not stable. CNAs do normal, routine tasks, stable patients. If it's not a routine task, you don't do it. If it's not a stable patient, not your patient. If you haven't been trained to do a task, not your task. We do normal, repetitive, consistent, normal. Principles, everything on the back wall is going to tell us how to do those tasks. We'll learn those as we go. But we have to do the skills the way we learn. Those principles are going to keep us in our scope of practice. If you don't follow those, you are outside of your scope of practice and liable for whatever you're doing. And then what we have to remember over everything is it's always about the patient, and we report all observations to the RN. So our foundation is the care plan. CNAs do normal according to the principles, keeps us where we need to be. And above everything, it's all about the patient, and we report observations. That's your scope of practice. 90% of the written tests that you're going to take is going to make sure that you're right in here, that you're not doing anything you're not supposed to be doing. Good? Okay, so let me talk to you. We're going to talk about the test in just a minute, but let me talk to you about tomorrow. You're not in class tomorrow, but I do a live game show on the first and third Tuesday of every month. And tomorrow is my game show. So I have 15 written test-like questions. Nobody can give you the actual written test questions. That's a test integrity thing. But I can give you questions that are really, really close to what you're going to see on the state exam. And it's a game show format on YouTube. So when you put an answer in, YouTube actually reads that answer and awards points. And then I give real prizes. I give out t-shirts, not the ones that not your class t-shirt, different t-shirts, card games, motivational prizes, all kinds of stuff. So if you're interested in knowing what kinds of questions you might see on the written exam, tomorrow at 11 a.m. is when I'll go live. I've been doing this for almost 2 years. So we have our playlist. I've got probably 500 questions in there that you can go through.
We can't
go on tomorrow at 11.
Go watch the replay.
Okay.
Yep. Go watch the replay. All right. So we know that the nurses are liable for everything that happens to that patient, even things we do. That nurse is liable. The nurse assesses the patient, looks for all real problems, potential problems, makes a care plan because that nurse is carrying the liability for that patient. Now, in a perfect world, it would just be me and the patient. If I'm liable, I'm going to do everything with this patient because at the end of the day, it's my butt on the chopping block if something happens. But the problem is that that's not really feasible in today's society. Nurses have way too many patients. I can't help this patient toilet and eat and brush her teeth and get dressed if I've got 3 other patients that need to be assessed and need medications, and I've got to call the doctor, and I have to look at the lab results, and I mean, there's lots of nursing stuff I got to do. So in a real world, I can't do everything with this patient. I need helpers. Need helpers. I need somebody that I can say, hey, I need you to go in and brush Mrs. Jones' teeth, but I want you to make sure that you don't brush on the top right. Just don't brush there because maybe she has a huge abscess there, right? Care plans identify issues with that particular patient, tells us what to do. So I've got to trust that you will go in and do exactly what I tell you to do. And you're not out there making up stuff on your own. It's not the Wild West. As long as I tell you to do it and you do what I'm telling you to do, I'm going to have liability for it. CNAs have liability if you step outside of that. If you decide to brush the upper right just because you're there, am I going to take responsibility for that? I told you not to. No, that's on you, not me. Do you guys see how that whole process works? Okay. So as the nurse, as the one with the liability, I'm going to determine which tasks I want you to help me with. In some cases, even though you know how to brush teeth, I may not have you brush teeth on her because of a situation that might be my task. But I'm going to have you brush everybody else's teeth. As a CNA, we need to understand that patients have differences in levels of care. And the nurse is going to decide what staff member does what care. Good? Makes sense? So we're going to work very, very closely with the nurses. But everything that I teach you to do in here is not all that you're going to have to do. In some settings, there may be other tasks that you're going to need to do. So let me give you an example. Let's say, now it takes me 4 weeks to learn your guys' names. I'm not real good with names anymore because my brain is old and full. So what is your name? Lisa. And what is your name? Abby. So Lisa and Abby are working in a hospital. They're both CNAs. And Lisa is working in just a med surg floor, just basic medical and surgical patients. And Abby is working in the mother-baby unit. So Abby, when she goes to work with the moms and the babies, she is going to be taught to swaddle infants. Now, swaddling means to basically make them into a human burrito. We use blankets and we fold them in certain ways to really have a nice, snug little cocoon for the babies. And it actually keeps them from crying a whole lot because it mimics how they felt in the womb. So you're going to have to learn how to swaddle babies, and you're going to get really, really good at it. Now, it's not something I'm going to teach you in class. No reason for it. And Lisa is not going to learn that skill because if you try to swaddle an adult, we call that a restraint. So that's not a skill that you would learn at all. But you might be trained to take out a catheter. on somebody that's getting ready to go home. Now, that's not a skill you're going to learn because it's not relevant. So additional skills will be taught to you based on the needs of the place that you're working and the type of patients you care for. This process is called delegation. When a nurse identifies a task that you can be trained to do and then provides training to do that task. Now, training does not have to be in a classroom. It can be at the bedside. Does not have to be formal. But there's some rules here. Now, the rules are something the nurse has to follow, but I want you to be aware that there are rules. The first rule is I've got to be able to do the task myself. Like, I can't tell you go perform neurosurgery because that's not even something I can do, right? So it has to be something that I can do. I also need to make sure that you have seen me do this task. I can't just tell you how. I've got to show you. And I've also got to make sure that you can show me that you know how to do it. It's called return demonstration. I have to make sure that the patient is stable and no surprises are expected. And there's no judgment required on your part. I can't tell you, well, if you think the patient needs it, go ahead and do whatever. There should never be a if you think with CNAs. It's either do it or don't. So there's a lot of rules that I have to follow, but one of the biggest rules is, does my state allow CNAs to do this task? And does my facility allow CNAs to do this task? Just because the state says, yeah, it's fine, doesn't mean your facility is going to allow it. Because if something goes wrong with the patient, remember, the nurse is liable. But who do you think they're suing? They're not suing the nurse. The nurse does not have anything to take. We don't get paid enough for that. They're going to sue the hospital. So the employer has a say in who's going to do what tasks, because ultimately they're the ones that are going to get sued. Make sense? So as a nurse, I have to figure out, first, does the state allow this? Second, does my hospital or facility allow this? And then I got to go through all of those criteria. Is it something I can do? Does it require judgment? Have you been trained? I got a lot of things I have to look at. Now, once I get through all of that and I realize, okay, I can train Lisa to take out a catheter. Everybody allows it. It's good. Then I'm going to train you to do it. And then I'm going to watch you do it. And there are going to be certain times that you're going to do that. Now, you go to work with Abby, right? Okay. So you get transferred into the mother baby unit with Abby because there's an opening. Now, just because you know how to take out a catheter doesn't mean that you're going to use it in that setting. Additional tasks that you learn are going to be specific to where you're working. Even though your knowledge will go over into other places, it doesn't mean that the task itself will. Good? Makes sense? That's a very confusing topic for CNAs. I just need you to remember that nurses can delegate. They have to go through a whole lot of stuff to delegate something. And you've got to make sure that you've received training before you go do it. And that you're comfortable with it. But ultimately, the nurse is still liable for whatever it is they've asked you to do. Chances are, as a nurse, I'm not going to ask you to take out a catheter. I'm going to do that myself. I'm not going to ask you to swaddle babies. I'm going to do that myself. Because if you swaddle a baby too tight or get the blanket in the wrong place, it can actually cut off circulation in areas. That's a big risk. And who's the one with the liability? Yeah. So I'm not going to delegate things that are likely to put my patient at risk unless I've got a very good reason to do so. Good? Questions? So the biggest question that most CNAs have once they get out there and they start working is that nurses are going to ask them to do things, and their question is going to be, am I allowed to do that? I'm plugged into a lot of CNA groups online. Oh my gosh, a lot of CNA groups. And this is the number one question. My nurse asked me to XYZ. Am I allowed to do that? Am I allowed to do that? And the answer is, have you been trained? If you've been trained to do it, and it's on the care plan or the nurse is asking you to do it, it's fine if you've been trained, because the nurse is assuming liability for that. So the answer to this is, have you been trained? Now, you are going to have a question on this on the state exam. It's going to say something like, you have not been trained to perform a task, and a nurse assigns you this task. What is your response? Yep, I can't do that. I need to be trained. Should you look it up on YouTube and take a crash course? Should you ask another CNA and try to figure it out? Should you delegate it to another CNA? No. Your answer is, I can't do that. Good? So we just talked about delegation, but I told you that a nurse has to look at state laws, facility rules, and has to meet a whole bunch of criteria to be able to delegate something, right? Notice I said nurse. I did not say CNA. CNAs cannot delegate, period. We only have two doors. We either do the task or we tell the nurse. That's it. We can't give the task to somebody else. We can't delegate it. We can either do the task or tell the nurse. That's it. Those are our only two doors. So you will have a test question on that, making sure that you understand you cannot delegate tasks to others. Okay, so good? Questions so far? Page 15 talks about liability. One of the things I want to point out here is that every lesson that I give you has questions worked into that lesson. This is a workbook style guide. If you can answer all of these questions, you know what you need to know for the questions that are coming on the test. Liability is very, very easy. Follow the care plan. You have no liability. If you're not following the care plan, you assume the liability. The nurse isn't covering you anymore. So if you really don't like your car, go ahead and, make up your own skills. But if you like your car and you're not following the care plan, they will come after it. Somebody will sue you and they will take everything you own. Everything. I've seen it happen. All right, so we're going to take a break, a 15-minute break. When we come back, we're going to talk a little bit about the CNA exam. So in the back, you're going to have Keurig coffee. There's creamer. There's snacks. The bathroom's back there. If you are a smoker and go out front to smoke, please do not leave your cigarette butts on the pavement or the sidewalk. There's a little can out there. Please make sure that you're using that. Let's keep our environment clean. All right, so we will see you in 15 minutes. So any questions on what we've gone over so far? No? All right, let's talk about the test. I have a lesson on this on page 12. It's going to go over everything. We're going to do the test registration next week on Wednesday. So you don't need to bring money to class. It's not, we're going to fill out the paperwork and then you're going to register when you're ready. I strongly suggest that you register when I give you the paperwork. That way you're testing about a week or two after graduation, which is perfect timing. If you wait too long, it's going to put your test date back even further. We're going into what we call busy season for testing. And yes, it is seasonal. This time of year, all the high schools, all the colleges, all the trade schools that have CNA programs are all graduating. All of those people have to test before graduation. So that means that you've got a lot of people trying to test all at one time. And that's unfortunately this time of year. So you can expect a little bit of a delay in your test processing time just based on volume, the amount of people that are registering all at once. So generally speaking, we say you should be testing 2 to 3 weeks after you apply. For you guys, it's probably going to be closer to 3 to 4 weeks. So kind of keep that in mind. The longer you wait, the longer it'll take. This high volume really kicks in mid to late April through May. That's like really high volume time. All right. So this is going to tell you a little bit about the exam. But let's talk about testing day. When you go to the testing center, and our closest one is in Tampa, it's off of Waters Avenue by the airport. That's our closest testing center. There's another one way on the other side by Busch Gardens. There's one in Temple Terrace. For those of you from Citrus County, you have one in Ocala. So you can choose to test at any testing center you want to in the state. So if you're a cruiser, you can plan a test in Miami and then jump on a cruise ship after. You know, so you can go anywhere in the state. Now, testing is uniform across the state. That means that if you test in Miami, you're welcome. You're fine. You're fine. If you're testing in Miami and somebody else is testing in Jacksonville and somebody else is testing in Tallahassee and they get ambulate with a gait belt, that test has to be the exact same in all of those locations because it's a standardized test. That's why the care plan will always be the same. That's why you're going to have to do things in a certain way because everything is uniform on a standardized test, even the skills part. So it doesn't matter what testing center you choose to go to, the test is going to be the same. A lot of times people say, oh, don't go to that one. Those evaluators are harder. It's the exact same test, and the evaluators grade you exactly the same. Now, let's talk about that grading part of the skills. Remember I said that this is the checklist that they're going to use? This is the actual checklist that is used to grade you. You're going to have 2 RNs in Florida. We have 2 RNs that grade you. There is nothing subjective about this checklist. Nothing. It is very, very clear. Was this step done? If it was, you get a check mark. If it wasn't, you don't get a check mark. There's nothing in here that requires any judgment on the part of the nurse. It is literally observation and check marks. That's it. So one evaluator can't be harder than another evaluator because it's very, very clear. Is the chair blue? The chair is blue, you get a check mark. If the chair is anything but blue, no check mark. Make sense? Nothing subjective. So it doesn't matter where you go to test. They're all following the exact same process. Okay. So we're going to go to a testing center. We need to be there about 30 minutes before test time. So what that means is everybody's going to be scheduled for testing at 9 a.m. That's just the form letter you get. It's all going to say 9 a.m. You need to be there at 8:30. If you're there at 8:45, they may not let you test, even though your test is at 9. You need to be there a half hour early because there's some things they're going to do. So when you go to the testing center, you're going to be there with 7 strangers. You are not testing with the people in this classroom. Everybody registers independently. You're going to be testing independently, which means you're there with 7 strangers. When you go, you cannot take any study material with you. You can't take any electronics in the room with you. The only thing you're allowed to take with you is your test admission letter, your keys, and 2 forms of ID, one with a picture, one with a signature. We'll get to that a little later when we go over the test registration. This is what we're going to take with us. Everything else should stay out in your car. So if you drove yourself, leave your phone out in the car. Leave your study material out there. If you get dropped off and you take your phone into the center with you, they're going to put it in a locker and lock it up for the entire day. You won't have access to it at all. If you leave it in your car, in between, at least you can go out to your car and have access to it. So I strongly recommend don't get dropped off if you can help it. Okay, good? Make sense? So when you go, you're there with 7 strangers and they're going to check you in. And then they're going to put you into a waiting room. Now, when they check you in, these are RNs. RNs assess as well as they breathe. They're just really good at assessing. That's what we are trained to do. So when you come in, I've got to figure out if you are you and you're not testing for your sister or your cousin or somebody that paid you $500 to take the test for them. I've got to make sure that you are truly you. And I'm going to use 2 forms of ID to do that. So I look at the test form, right? Your admission letter, which looks like this, has your name on it. This is what you put in when you register. So I've got this in front of me. And I'm going to ask you for 2 forms of ID. One with a picture. I'm going to make sure that matches you. I'm going to make sure the name is the same as what's on here. The second form of ID has to have a signature. So a driver's license will work. Voter's ID, I think they have signatures. Library cards, I know do. Debit or credit cards, passport. You just need something with a signature. But the names on all 3 things have to match. Your test admission letter, the name that's on here, the name on your photo ID, and the name on your secondary ID have to match. Have to match. So if you've got your, let's say your driver's license has your first, middle, and last name, married name. But your library card has your first name, your maiden name, and your last name. Those are not the same. You've got to make sure they match. I have had students that go to the test, even though I go over this, and you're going to hear me say this again when it comes to test registration. Even though I go over this, I have had students that register but did not have 2 forms of ID that matched. They go down to the testing center and they were turned away. They do not give refunds.
Is that including like a middle name on both? They both have to have
the same, right. And this is a problem for women particularly, because especially if you have 4 names, and there are people out there that have 4 names. You got to make sure that your IDs match, because otherwise they have no idea of verifying that you are you. They have no way of doing that. So you want to make sure, especially if you're married, that your middle name is on whatever you're using, or your maiden name is on, but they've got to match. Got to match.
Do the addresses
Addresses don't need to match, just the names. Yeah, you're fine. You're fine. So you get in, they verify your IDs. I find out that you are you. That's great. But I'm also kind of taking a look at you. And then I'm going to ask you a very specific question. Do you have any conditions that would keep you from being a patient for any one of these skills? Now, most of you are going to say, no, I'm good. I'm fine. No problems here. But some of you may have an issue. If you just had oral surgery, you need to let them know, because you are not going to be a patient for mouth care or denture care or feeding. If you've got athlete's foot on one of your feet and it's dry and cracked and bleeds occasionally, you are not going to be a patient for foot care. If you are allergic to milk, we can't feed you pudding. So if you've got an issue, you need to let them know. Most of you will say, no, I'm good. I'm fine. No problem. So once they get you checked in and they ask you questions, they're going to send you to the waiting room. And you're going to sit there with 7 other strangers. Now, when everybody is, and I got 8 of you in here, so when everybody is all checked in, those evaluators are going to disappear for about 20 or 30 minutes. And you're sitting there bouncing your leg because you want to get this test over with and you're anxious. Let's go. Let's go. What's happening? Well, those 2 evaluators are in another room trying to match you up into pairs. This is not random. Not random. I can't just put you 2 together. And you 2, and you 2, and you 2. It doesn't work like that. Let's say that you get transfer from bed to wheelchair. You got to pick somebody up, turn them, and sit them down in a wheelchair. We have to, so that the test is uniform. Remember that uniform part, right? We got to find somebody about your body size or smaller, roughly. Right? So I'm looking around. I got to figure out who to put you with. And then I got to make sure that they're a good patient for the other skills that you have to do. So this is very complex for the evaluators to do. It's not just as simple as you 2 go together. They also won't put, you 2 are related, right? Yeah. They won't put you 2 together, because they're afraid that you are going to give her some nonverbal cues to let her know when she's not doing something right. So you 2 would not be paired up together. I separate you guys. So that means that there's a whole lot going on before you ever get into the test. Does that make sense? Okay. So once they've got you guys in the waiting room and they decide what groups you're going to be assigned to, they're going to come out and give you some very specific information. So just for the sake of simplicity here, I'm going to put you 2 together, and you 2 and you 2 and you 2. So you guys are group 1. Don't go anywhere. You guys are group 2. You've got about 45 minutes to an hour to kill. You need to be back in this room in an hour. But you don't have to stay here the whole time. You can go out to your car and study or watch videos or read a book or play a game on your phone. I don't care, but you can, as long as you're back in an hour. You guys have got about an hour and a half or so to kill. So Target, clearance shopping, we'll see you in a little while. You guys have got about 2.5 hours before you need to be back in this room. So 2 for 1 margaritas at Chili's. We'll see you later. You guys are brought into the testing center and you've never been there. So they've got to show you around. Now, a testing center has a waiting room, it has a computer room, and it has a skills room. And these are separate areas. So I bring you into the testing room, the skills room. You've never been there before. You don't know where to find the washcloths. If I put a wall up right here with a door in that wall, this would be the testing skills lab. You guys are in a waiting room way over there. You cannot see or hear anything that they do in this room. So testing is private. It's not on a stage in front of hundreds. It is private. There's only 4 people in this room. Me, the other evaluator, and you 2. But when you come in, I've got to show you around. So we're going to show you where all of the supplies are, and they're here on this shelf. This is all of our supplies. Over here is your 3-drawer cabinet, and they're always set up the same. Grooming supplies in the top, grooming. Bathing supplies in the middle, bathing. Toileting supplies on the bottom, toileting. So just like a human, grooming, bathing, toileting. That's how these are set up. They're going to show you how to use the bed in this center. Those are the bed controls. They're going to show you their call light, and they're going to show you what they use for a privacy curtain in the testing center. Now, if you notice, this privacy curtain does not go all the way around the bed like they do in a clinical unit. That's because you're being tested. If the curtain went all the way around the bed, they wouldn't be able to see a lot of the things that you do. So curtains for the test are going to be very short, and they're kind of an example of. Make sense? Good? So they're going to show you all of that. And then they're going to pick one of you 2 to go first. So can you give me a number 1 to 11? 7. Okay, so the computer randomly picked skill set 7, and you're going to go first. So this is your care plan. These are the 3 skills you are going to have to demonstrate on her. So feeding the resident who's in a chair, providing hand and nail care, and ambulate the resident using a gait belt. This is the same care plan set we talked about earlier. So you're going to do those 3 skills on her. Now, when you're the patient, you're going to get some very specific instructions. You're going to be told for the first one, feeding a resident, to slump or slouch. Second one, hand and nail care, no specific instructions. Just be you, pleasant and cooperative and you. Ambulate the resident using a gait belt. You're going to walk like you walk, not a 90-year-old version of you. You're going to be you. So when you are playing the patient, you're not going to overact this. You're not going to go, A lot of people try to do that. That is not what this is about. This is not about trying to make the skill harder for her. Remember, all skills have to be uniform. So you're going to be told to be pleasant, cooperative, and you. Good? Now, if you guys have got people at home that you're going to be practicing on, and I strongly recommend that you find some people to practice on, you need to tell them at the very beginning, my instructor said, don't make this hard, because you're not preparing me for the test. Because the test is not going to have hard patients. Make sense? Okay. So let me explain to you a little bit about the test itself. CNA testing is based on something called minimum skills competency. Minimum. What does minimum mean? Lowest possible. Lowest possible. If I told you the minimum jackpot on lottery was $40 million, that means it's the lowest possible prize you could win. Lowest possible, right? Minimum skills competency means lowest possible. So they set the bar for testing way down there. Way down. They are not trying to make sure that you are a master of anything. That's not what this is. They want to make sure that you're paying attention to the patient, you're following the care plan, and you understand basic safety. That's what the test is about. So if you go in and you follow the care plan, you pay attention to the patient, and you understand safety, you will pass. So I want you to kind of take, oh my gosh, this skill set's gonna be super hard out of your mind, because that's not what it's set up to be. minimum skills competency. Now, the real problem here is going to be a confidence problem. And that's because you guys are going to compare your performance to me. Because you're going to see me do these skills. And you're going to think that you're doing the skills has to look like me doing the skills. I have been a nurse for over 35 years. I can't make this stuff look hard if I wanted to. I make this stuff look super easy because I've been doing it my entire adult life. I am not the measuring stick that you are being measured against. You are. You are. You are. You're being measured against other yous, not me. Now, I want to get this out of the way at the very beginning because as we start to go through this and you see me do these skills and then you try to do the skills and you're like umming and uhing your way through it and going back and doing steps you forgot to do and it looks messy and it looks chaotic, it's okay. But when that happens, you're probably going to think to yourself, oh, I'm going to wait a little while to apply for the test because I'm not ready yet. I'm not ready yet. I'm not ready yet. And what ends up happening is you will wait too long. And your confidence will not get any better because now you're further away from me. You haven't watched the videos. You haven't been practicing. You just get further and further away and then you don't test. And then you're back in my classroom in 2 years. And as much as I would love to see you, that's 2 years worth of income that you've just given up because of a confidence problem. So I'm going to tell you that you are more than ready to test. And I haven't shown you anything. You are already more than ready to test. Good. Don't put registering for the test off because you have a confidence problem. That confidence will never get any better than what it is when you graduate. Both. We're going to get there. Yeah, both. So they break you up into groups of 2. You get a care plan and you're going to do those 3 skills on you. You're going to be the patient. And that's the physical part of the test. So there's 20 skills they can ask you to do. So they're going to take you into the testing center, show you around. They'll get a care plan that's assigned by the computer, not the evaluator. They don't get to pick your skills, assigned by the computer. They will read that to you. It's one of these. They will read that to you because they can't even trust you know how to read. Seriously. They will read this to you, and then they're going to hand it to you. And this is now yours throughout the entire skill. You can go back and look at that anytime you want to. What do we know about the care plan? Follow it. If you can't remember what it says, how can you follow it? You can go back and look at that care plan anytime you want to in the middle of a skill. You can be knee deep in toothpaste and go, hold on, and walk over and look at that care plan. Okay, yours. You're going to do the skills in the order listed on the other person. They do time you. We're going to get into timing a little bit later in the program, but each one of these at the bottom has the time associated with that skill set. You go to page 25 in your book. Up in the top corner of each care plan clipboard, you'll see the time. You guys see that? But it's way more time than you actually need. Way more time than you actually need. There's a formula they follow. I have a whole lesson on that we'll get into later. So you can see how they're coming up with that timing, but it's way more time than you actually need to do the 3 skills that you're assigned to do. Once you've done your skills on her, she's going to get a different care plan set. It's going to be read to you, and you'll do your skills on her. You guys will then go out to the waiting room and wait. You can go to your car. You can go to Chili's, but you're going to have to be back in about 2.5 hours. You guys would be brought into the testing room, shown around. You'll do your skills on her. She'll do hers on you. You'll go back out to the waiting room. Repeated with your set, repeated with your set. When you're all done, everybody's done the clinical skills test. Then they'll take you into a computer room. Oops. We've already gone over that. Then they're going to take you into a computer room. We'll get to that slide eventually, I guess. And you'll take a 60-question multiple choice exam on the computer. This is not a hard test. If you want to see the types of questions, tomorrow morning at 11, I'll be going over 15 of them. There's a test plan that they have to follow, certain questions from certain categories. It's very well thought out. This test is extremely scientific, designed to be very fair. But you'll do 60 questions, multiple choice. And we're going to get into those types of questions a little later in the program. But the written test really is not hard for you guys as long as you understand your scope of practice. Which, remember I said first hour, I gave you everything you needed to know. So when you're taking the skills exam and they have this checklist in front of them, when you do a step properly, you get a check mark. If you don't do a step at all, no check mark. If you do a step but do it wrong, no check mark. Anything without a check mark is called a deficiency. And this is what's going to determine whether you pass or not. After you take your test, the evaluators put all of your deficiencies into the computer. And the computer will figure out, okay, that was pretty important. Probably shouldn't have been missed. Like you didn't put the head of the bed up when you brushed teeth. One deficiency. And you failed. You missed one thing and you failed. Why? It's important. It's not about you. It's about the importance of the step. Good? Make sense? So it's not how many you miss. It's how important were those missteps. So anything without a check mark is a deficiency. That's put into the computer. The computer decides whether you pass or not. Now, in Florida, we have 2 evaluators, and they both have to grade you independently. What that means is that each one of them has their very own checklist, and they're not supposed to get together and compare notes. So I am watching you do your skills, but so is evaluator number 2, and we're not talking. I'm just checking off everything you do right. And at the end of the test, when I go to put this in the computer, if I show this as a deficiency and he does too, that means there's a pretty high likelihood that you didn't do this step. It's going to count against you. But if I show this as a deficiency, but he's got it checked off, that means I wasn't paying attention. It's not going to count against you. Good? Make sense? Now, there's going to be a way for you to see this in just a minute, so I need to bring that to your attention. All right. So I have a whole lesson on this, skills grading, on page 65. It's going to explain to you how they're going to use these checklists to grade you on the state exam. And you can read that on your own, but it's pretty much what I just talked to you about with deficiencies. Now, after you take the skills test, you're going to take a written test. This is on a computer. You need no computer skills. They're going to have you logged in. All you got to do is be able to move a mouse. That's it. This is a 60-question multiple choice test, but only 50 questions are graded. 50 questions count for you or against you. The other 10 questions don't have any bearing on your score. They're used as kind of trial questions to figure out whether they can be used on an upcoming version of the test. If the question isn't written correctly and it misleads a lot of people and a lot of people answer it wrong, they know there's a problem with the question. So 10 of the questions don't even count. You won't know which ones. You won't have any idea. But you're being graded on 50 questions. You have 90 minutes to do all 60 questions. Usually not an issue. Usually goes pretty quick. But I have a resource to help you with the written test. Now, most people fear the written test because it's the only type of test you're usually familiar with, right? We've all taken written tests throughout our whole school career. We know what written tests are all about. And you've probably had a couple bad experiences along the way, so you fear the written test. Very common. You don't need to fear this written test. This one is remarkably easy once I'm done with you. In fact, you'll probably laugh at some of the answers once I'm done with you. But I do have a resource to help you with this. I have a free ebook that you can download. This is going to be in your wrap-up email today, so you don't need to write this down. But this ebook is on my website, and it's specifically designed to give you the knowledge that you need to pass the written test. So the written test really has to do with 5 categories. Know your role. And I just spent an hour and a half talking about our role. You also need to know normals, and that's different for, you need to know normal vital signs too. Yes, it's part of normals, but it's actually a little bit more complex than that. You have to know what's normal for aging people, because remember, half of our job is observation and reporting. If we don't know what normal is, how in the world are we going to find abnormal? So a lot of that is going to be covered in this program. Know your normals. Safety is graded on the written. It's going to have some safety questions. Patient rights. This can be summed up very easily. Never treat an adult like a child. Period. If it's something that you would do to a child, you cannot do it to an adult. We do not put adults in timeout. We do not make adults say please and thank you. We do not lock adults up in a room. We do not put adults in a corner to make them behave. You cannot make another adult behave. You just can't. But there's going to be 3 or 4 test questions that are going to try to convince you that you can. Those are not the right answers. Does that make sense? It's something that you do to a child. You cannot do it to an adult. There could be an argument that you probably shouldn't do it to a child either, but you cannot do it to an adult. Okay? Now, at the end of the day, you've taken the skills test, you've taken the written test, and you're ready to leave for the day. Now, sometimes the written test does come first, occasionally, very rarely, but sometimes the written test does come first. Usually it's skills first, then written. And the reason is, if you fail one part of the exam, you only have to retake that part. Most people fail the skills, not the written. So when you go back to retest, they don't want you there all day. They're not going to put you in group 4 way over there and make you wait all day. You've already been here once. You've already done your waiting. You're going to be in group 1. Retesters are in group 1.
So they actually give you another chance?
They do. You actually have 3 chances. We'll get to that in a minute. You've got 3 chances. But when you come back to retest, because most people fail the skills more than the written, the skills is usually first, and we do retesters in group 1. Get them out. People that are there to retake the written test, if we have several of them, then they may do the written test first just to be able to get them out. So the evaluators can play with this. It may be written first. It may be skills first. Go with the flow. Go with the flow. They'll tell you what to do. But once you're done with both sections, at the end of the day, they're going to give you some printouts. And the printouts look like this. This is the printout for the written exam. At the very top up here, it says, congratulations, you passed the that's in the wrong order. Okay. Congratulations, you passed the written test. Down here, where is it? There it is. Okay. Congratulations, you passed the written test. Down here, it's going to tell you the category of question, how many questions was in that category, and how many you got right. Again, you're going to ask me, how many can I miss and still pass? The answer is, if I'm the body in the bed, none. Do you think I want a CNA that missed some questions, barely scraped by, but man, they're a CNA? Do I want that person taking care of me? So your answer is, you should be going for none. This test is graded much like the clinical skills, though, in that the answers are weighted. The answers are weighted. You will have one question on the written test that is called, it's a very special kind of question. It is called a critical concept question. A critical concept question is going to put you in an emergency situation and ask you what you're going to do, because in an emergency, we don't have time to go find a nurse. We don't have time to consult a care plan. We need to know how to act. So if you're feeding a patient and they start gagging, they put their hand up here, they start to turn blue, there's no air exchange, there's no sound, that patient is choking. Should we just let me go get the nurse to figure out what to do here? Yeah, if we leave the patient to go get the nurse, now the patient is alone and choking, and that's terrifying. But it didn't help the problem, did it? So this is an emergency situation. We don't have time to look for help. So your answers are to perform an abdominal thrust, to leave to go get the nurse, to watch the patient to see if they get any better, or to offer them a cup of water. What would you do? Abdominal, right? That's the right answer. That's the one we would hopefully choose. And if you chose it, you'd get it right. We'd move on with our lives, no problem. But if you chose any of the other answers, not only are they wrong, there's one of them that is an automatic fail because it puts the patient's life in mortal jeopardy. And that's give the patient a drink of water. You taking retesting, I passed the knowledge first. I failed the skill 3 times, went back to school. Now I registered for 2. So what should I do in this case, but different place for testing? Betty,
I believe she's saying she failed the test 3 times.
Yeah, and
120-hour program. Is there anything else you would recommend she do beyond changing her testing center?
yeah, just watch the live stream. It will help you prepare for the test. Now, if you took that passing score will stand for 2 years. We're going to get to the 3 times in a minute. Passing score will stand for 2 years. So in this case, she took the written test and she passed. So that score stands for 2 years. She took the skills test 3 times and failed all 3. So now she either has to go through a 120-hour program, or she has to wait 2 years, in which case this one drops off and she takes both sections again. So she took a 120-hour program. So now the question I have is, are you still in your 2-year window? If it's not been 2 years since you passed the written, right? If that written test is still valid, then you just have to take the skills. If it's been 2 years since you took the written test and passed it, then you have to take both sections. Hope that helps. Okay, so we have this. It tells us how many questions were in the category and how many we got right. Remember, there will be a question that just one question can fail you. If you're putting your patient in your choice puts the patient in mortal jeopardy. Why would that fail us? I mean, that doesn't seem fair, does it? One question can fail you. Why? Yeah, you have made a choice that actively puts your patient at risk. Does that make sense? So it's not that they're trying to be unfair. And a lot of people look at it that way. Oh my gosh, I only missed one question. How could they fail me on that? I just missed one question. Well, it wasn't even that you missed the question. It's the choice you made when you missed the question that failed you. So the test is not about us, is it? Make sense? Okay, so you get this, tells you about the written test. Then you get this one that tells you about the skills exam. Looks a lot alike. This at the top says you passed the skills exam. Good job. Hold on, Jen, I'll help you. And then down here, it's going to tell you what skills you had. But this is the page that we want to pay attention to. This one right here. This lists your deficiencies. When you were being graded, anything without a check mark was a deficiency. I put deficiencies in, and so does he, because we graded you independently. So if a deficiency is listed twice, it counts against you. If it's only listed once, it did not. So I'm going to pass this around so you guys can take a look. These are always up here. They are available for you to look at any time. Yes, Jen, absolutely. I work in mental health, and I can say with 100 or 1,000% accuracy, you cannot make adults behave. Absolutely. Absolutely. And I'm one of the adults that doesn't behave. So tell me to do something, I will not do it just out of spite. Yep. Okay. So any questions on this, the grading reports? As long as both of those reports say you passed, you're a CNA. And you can actually use these papers as your temporary certification until you get the email from the Board of Nursing with your CNA number. So these two papers become your temporary certification. You can go to work right away. If you failed one of the sections, whether it's written or skills, you have to wait 30 days to retest. You can apply right away, but you have to wait 30 days to retest. And you only have to take the portion you failed. So if you passed the written and failed the skills, you'll retake the skills. You have 2 years to pass both sections. If you fail 3 times in that 2-year period, you have to either complete a 120-hour program with clinicals. Those are the ones usually held at colleges. Or you have to wait 2 years from your last attempt for the whole thing to reset. My goal is that you don't fail. That's my goal. I cannot remember the last student, like I said, I've been doing this 17 years, that I had that failed 3 times. I can't even recall one. Most of my students don't fail once. If English is not your first language, you might struggle a little bit with the written, and that's because of a translation issue. But most of the time, when you do the skills, the evaluators are going to tell you, yeah, I know where you went. I know who your teacher was. And that's because our students are taught a very specific way. And you won't get any deficiencies, none. None. Okay. I'm here to make sure of it. So I told you this program's a little different than it was 17 years ago when I first started. And my first couple of classes, I didn't do so good. I thought, well, I'm an RN. I can teach. I mean, CNA, it's just a nursing assistant. I mean, I've got enough knowledge. I can teach CNA. And I did what a lot of nurses do when they first start teaching, is I started focusing on the things that were relevant to nursing. We went over body systems. We went over medical abbreviations. We talked about medical terminology, healthcare systems, the difference between Medicare and Medicaid. And oh man, I just shoved a ton of information at you and thought I was preparing you for a nursing assistant test. And I wasn't, because that's not on the test. So my first couple classes, not so good. Now, I'm a problem solver. I always have been. And if you give me a problem, I'm going to dive into it head first to see if I can solve it. So this was a problem that needed to be solved. So I said, okay, well, if I'm not doing so good here, maybe I need to look at the test a little bit closer. Let's see if I can align what I'm teaching with the test. So I started looking at these checklists, and these checklists are free and available to anybody. They're on Prometric's website. They're right there for you to see. So I pulled up the checklist, printed them off, and I started to notice something. So step one for every single skill was exactly the same. Exactly. Didn't matter what the skill was. Step one always said, greet the resident, address by name, and introduce self. So if that has to be done for every skill, well, we probably ought to teach that. This is where we start. We're going to greet the resident, address them by name, and introduce ourselves. That's where we're going to start. That way we get that one checked off. So then I kept going down. The second thing that was on every single checklist was to provide explanations to resident about care before, beginning, and during care. So we have to talk to them, tell them what we're doing. So we probably ought to work that in because it's on every checklist. Let's work that in. So far, we have to greet the resident, address by name, and introduce ourselves. And we have to provide explanations. Okay? Every checklist has those two things on it. Well, then I kept looking, and toward the end, I started seeing the same verbiage on every checklist. Ask resident about comfort or needs during care and before we complete the care. Oh, so we have to ask them about comfort. That means that we actually have to say the word comfortable. And then I kept going, and I noticed that all the rest were the same as well from there down. So, okay, well, that means that we have to start every skill the same way and end every skill the same way to get credit for those checkpoints. Now, this is so important. This is green. This is how we start every skill. Red is going to be how we end every skill. That's our closing. This is the checklist for one of the skills we're going to learn how to do. Do you see how much red and green is on there? Do you see that? Over half of those checkpoints is how we start the skill and how we end the skill. In fact, there's only 5 things that have to do with the skill itself out of that whole checklist. And I thought, wow, that must be a fluke. So I looked at another one. And then I looked at it. Looked at another one, and it just kept going. All of this red and green all of this red and green and red and green and red and green. And it just kept going on and on and on. So I thought, okay, that's something I can work with. If I teach you to go in and start the skill the same way and end the skill the same way, you're guaranteed to get half of these checkpoints. Not even knowing how to do the skill, you'll get half of your checkpoints. So that's what started everything you see on the back wall, what we call the principles. And the principles are going to tell us how to do the skill so we get all of the checkpoints. So when I tell you I did a deep dive into the test, I mean, this was the only thing I did for 5 years. I studied this test inside and outside. We were a testing center. I interviewed tons of test evaluators. I made this my mission in life. So everything that I'm telling you has a relevance to the test. And this is why I can tell you with high levels of confidence that you guys will pass, because I've demystified the test. But for me, it has to go beyond that. Sure, we know that we have to greet the resident, address them by name, and introduce ourselves for the test. We know that that has to be done for the test. We want to get it checked off for the test. But we have to go a step further than that. Do you think that those steps might be important when we're dealing with real people out in the world? Okay, so let's talk about the patient for just a minute. Because the test is not separate from what we do. The test is completely integrated into what we do. So let's think about this lady for a second. When you are sick, where do you want to be? Whose bed? Your own bed. You want to be home. It is the one place in the world that you will always seek to get to when you don't feel well, because it's your safe space. It's your place. So patients are much more comfortable at home in their own bed. This lady, is she at home in her own bed? No. So right away, we know that she is not comfortable. Where do you want to be? At home. So right off the bat, we know she is not comfortable. Now let's think about her position. She is laying down. That's a vulnerable position. If you are laying in bed and some stranger comes in through your door, are you going to stay laying down? No, you need to be on your feet to face a potential threat. Laying down is vulnerable. And yet in healthcare, we make everybody lay down. We are increasing their vulnerability. And we have to understand that that's going to play a huge role psychologically. We are making them more vulnerable. And we do it so that they hopefully will let us do what we want. We'll make them more submissive. Do you think that making somebody more vulnerable is going to make everybody more submissive? No, in fact, in a lot of cases, it's going to make somebody more irritated, less submissive. Does that make sense? We have to understand that. So we've got this lady who is sick and in a place that's not her own, who is laying down. Now, what's the one thing you need when you're sick? Medicine, rest, sleep, comfort. Yeah, absolutely. So we want to be cared for, cared about, and left alone. Let me just rest. Do you know where the worst place to try to get rest is? In a hospital, yeah. On average, somebody comes in that room every 17 minutes around the clock. That's crazy. How in the world are we supposed to get any rest at all? Now, I want you to think about the people that are coming in. These are not people they know. These are complete strangers. Complete strangers. So they are in a strange place, alone, because we restrict visiting hours, surrounded by a bunch of strangers, in a vulnerable position, and not dressed for company. Do we see the mindset of this patient? So when we enter a room, it is vital that they know who we are, what we are, why we're there, and that we mean them no harm. CNAs do not hurt patients. We are the only part of the medical team that does not hurt a patient. Phlebotomists come in to stab you 15 times to get a vein the size of Texas. I don't know why they miss them, but they do. Nurses start IVs. They do all kinds of bandage wounds. They do all kinds of things that cause pain. Doctors, oh my gosh, they stick sharp things in all kinds of places that sharp things don't belong. X-ray techs put you in impossible positions on hard surfaces and ask you to hold still. EKG techs put sticky tabs on you and pull every hair you did not know you have out of your skin. Every person in healthcare will hurt this patient except for the CNA. Do they know that? No. So they will automatically look at you with a high degree of suspicion. Does that make sense? If you want to get anywhere with your patients, you've got to make friends. And the only way to do that is to treat them like a human. But we forget that in healthcare. We start getting involved in our own day-to-day routines. I've got 12 patients to take care of. I've got 3 blood sugar checks, 4 vital signs. This one has to get ready for surgery. This one's being discharged. You're all tied up in your tasks that you forget that this is an actual living, breathing human. These things that I'm about to teach you are not optional once you start work. It's what's going to form that connection with your patient that gives them the trust to allow you to do what you need to do. Otherwise, you're going to be fighting your patient every step of the way. Good morning, everyone. Thank you, Miss Patty, for your videos. They are really helpful and more informative for me when I was taking my CNA exam. At the time, I passed my exam, both written and skills. Congratulations, Natalie. Great job. All right. So even though these are going to give us checkpoints on the test, we're learning it to do in a clinical setting. We should do this with every patient every time we enter the room. So the first thing we're going to do is knock. Every skill starts with a knock. And that's because this patient needs to rest. I want you to think about this for a second. Let's put ourselves in this patient's place. You are not dressed for company. You are laying down. You're in a strange place surrounded by strange people. You are sleep deprived, which makes you grumpy. You're sick, which makes you grumpy, right? This is not set up for a good patient encounter here. And she finally drifts off to sleep. And she hears a sound and her eyes pop open and I am standing over her with a sharp object in my hand. How comfortable is she? Not at all. So this space has to be a safe space for your patient. If they open their eyes and there is a threat, that's a problem. They're not going to be able to rest at all now because they're going to be afraid that every time they close their eyes, there will be a threat. So this is why we have to knock. Knocking keeps this space safe for the patient and allows them to rest when we're not working with them. No knock, combative patient. Those two go together. So every skill starts with the opening, but every opening starts with a knock. Do not skip that. This is not just for the test, although it does check off a checkpoint. This is not just for the test. This is for real life. And we have to understand why this is a testing principle. It's not just to check something off. It's because it's relevant to the patient. Good? So as we're learning this, I've got these up here. You can play with them if you want. These are the checklists for every skill. You'll see the care plan there. You'll see the principles that govern how we have to do this skill. And then these are the actual checkpoints if you're interested in seeing what you're being checked off on. But I've got them color-coded so you know what's being checked off with each principle that you're performing. So these are always up here and available for you to look at if you want to. But the way that I'm teaching you, you shouldn't have to look at these. It should just start to make sense. But I need you to know this is another resource for you if you start to feel confused or falling behind. All right. So for the exam, just to recap, you're going to be divided up into groups of 2. You are going to be assigned 3 skills to do. They're going to read you the skill title and the care plan, hand it to you, and then give you the amount of time that you have to perform those 3 skills. While you're doing those skills on another testing student, you'll be graded with the checklist. The checklist has a lot of common points that they share with other checklists, and that's how we're going to learn to do the skills, by learning these common points and then filling in all the blanks after. So, this is a checklist for drainage bag. So as you're looking at this, it won't really tell you as a student what to do. It's telling you what you're being checked off on, but it doesn't really give you step-by-step instructions on how to do this skill. This is written for an RN because that's who's grading. That's who's using this. That's who's grading you. This is written for an RN. So if you look at this, you won't always know. I mean, some of it's pretty clear, but you won't always know what they're trying to get you to do just by reading the checklist. What you need is an RN to translate this into actionable steps for you. And that's what I did with your book. So I took these checklists, I found common points, we created principles to teach you how to do these common points, and we're going to learn those common points along with the skill-specific steps. So we're learning principles and we're learning skill-specific, but we're going to do it together. So the hard part of this class is the first 2 weeks. After that, we already know skill. We know to follow the care plan. We know it's the care plan, the whole care plan, and nothing but the care plan. And we know to report all observations to the nurse. We know that. We're going to learn the opening, and we're going to do that for every skill. We're going to learn the closing, and we're going to do that for every skill. So by the time we get to week 3, you're going to be like, yes, I know, because we're going to review them every single class. And by week 3, you're going to be like, okay, enough already. I got it. Let's just focus on the skills specific. But that repetition is going to be what takes you through the test and into the workplace, because these things are going to feel awkward and odd if you're not doing it. Repetition is the key to this program. But along the way, we have something called the Big 4. We've already learned one of them. We already learned skill rules. We follow the care plan. The care plan, the whole care plan, and nothing but the care plan. While we're following the care plan, we'll make observations, and then we'll report those to the nurse. We've learned all that already. So we know skill rules. We're about to learn the opening and the closing today. And then on Wednesday, we're going to learn about gloves. I have got an hour lecture on gloves to go through with you. But those are called the Big 4, and they're going to apply to every skill that we do, no matter what the skill is. These are the Big 4. So the principles that I'm talking about are all laid out for you on page 27. These are all the principles that we're going to learn. It's everything on that back wall. Nothing unusual here. We're going to learn them one at a time, but I'm going to explain to you why each part is important. And I'll bring some stories in as we go to make it make sense to you. Now, the one thing that you don't see on that back wall is this, resident rights. I actually have this up here because it really should be front and center of us, everything that we do. The resident rights is all about how we treat the resident as we're doing the skills. So we're going to treat them with dignity and respect. We're going to freely, we're going to communicate with them. Patients have the right to freely communicate. We have the obligation to facilitate that. So rights and obligations. But these are all patient rights. We'll be going over this a little bit more as we go through the program, but you can always see them up here as well. I have flashcards that will help you with learning the principles and the steps and the supplies. We'll talk about that a little bit more later. But flashcards while you're enrolled in the program are discounted to $14.99. Once you graduate, they go back up to, I think it's $29.99 on our website, but they're right here. You can see what they look like. So we just talked about this, right? The patient experience. Remember that your patients are a little bit self-absorbed when they're sick. They're feeling vulnerable. They're not dressed for company. They're estranged from their family. They're probably pretty fearful. And we need to keep all of that in mind when we're working with our patients, because that's going to affect how they deal with us. The maddest I've ever gotten at a CNA, and I've had some pretty bad CNA encounters, but the maddest I've ever gotten at a CNA was when one told me, well, she started it, and pointed to the patient. You should have no expectation that your patient will act in any kind of way, ever. Your patient is having the very worst day of their life. Do not expect them to be nice. Do not expect them to be accommodating. Do not expect them to be polite. That is not their role. That's yours. Do not have an expectation that a patient is going to act any kind of way. If you have a nice patient, that's a bonus. That's a good shift. That's the ideal situation. But it's not always going to happen. Sick people have a right to act sick. And we have an obligation to facilitate what they need. Good? We always have to keep our patient's point of view in the front of our mind, because it's really easy for us to overlook when we get so tied up in our own day-to-day. We expect that patient to act the way we want them to act. And that gives a lot of chances of conflict. Every patient that we deal with is going to be different. What works for one will not always work for another. And this is why care plans have to be individualized. So along the way, you're going to have some questions. You're going to think about different accommodations. Well, what if the patient can't roll on their own? What if the patient can't lift their hips? What if the patient starts to fall? What if the patient can't take out their own dentures? What if? Now, all of those what if questions have to be answered by the nurse taking care of that patient. I can give you answers, but that answer is a fictitious patient in my mind that may have a level of ability that your fictitious patient doesn't. Everybody is different. That's why care has to be individualized. Can you imagine if they treated all diabetics exactly the same and ignored high blood pressure on half of them. Just ignored it. We wouldn't have good patient outcomes, right? So we can't treat everybody exactly the same. Not all breast cancer patients are going to get the same treatment. Not all paraplegics need the same care. Make sense? Okay. It's the differences that are going to be displayed on the care plan. All right, so along the way, you're probably going to make some mistakes, and that's okay, because remember, minimum skills competency. We're judging you way down there. And you're probably going to make some mistakes, and that's okay. Mistakes are okay. But if you correct the mistake when you realize that you've made one, like as soon as you realize you made one, correct it. Remember those check marks that we talked about, right? You do a step right, you get a check mark. If you don't do a step, no check mark. When you make a correction, you get a check mark. That paper has no idea that you corrected it. There's no difference in check marks. So let's say, now remember we learned that we have to knock. Let's say we get into the skill and we totally forget our opening. We just don't do it. We just go right into doing the skill with the patient. Okay. Totally missed all of those check marks in the beginning. As I'm working with the patient, if I realize, oh my gosh, I didn't do my opening, this person has no idea who I am, we can say, correction, I would have done my opening, knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? I'm going to close your curtain, wash my hands, and now I can do my skill. If we correct it, we get a check mark, just like we did it. So corrections can be made on the state exam. If you make a mistake and you realize you made the mistake, correct it immediately. And most of the time, they're going to tell you we need to see it. Like I can't say, correction, I would have done hand and nail care. That's like the whole skill. You can't, you would have to demonstrate that. But let's say that you get all the way done and you realize you never closed the privacy curtain. We could say, correction, I would have closed the curtain in the beginning and I'm opening it now. Good? You see how corrections can work? I have a whole video on that you can watch on my website. I will be sending you that link later today. But any lesson that has this little video clapboard, that means I have a video on it. Most of my videos are going to be animated style, like what you saw earlier. And they're on my main website, 4YourCNA.com, under animated lessons. That's where you can find them. But I have a video on that as well. You want to try to make your corrections as soon as you realize that you've made a mistake. Don't wait until you get all the way to the end and try to correct everything at one time because you'll forget. When you make a mistake and you recognize it, correct it as soon as you recognize it. Don't wait. At the end of the test, you're going to have to declare when you are done with the first skill before you move on to the second. Now, this has to be done verbally, and it has to be done. Because when you say, my skill is done, you are locking in your performance. No corrections can be made after that. So it's like hitting a red buzzer on a game show. That's it. So you can't get into skill 2 and say, oh no, I made a correction. I need to correct something on skill 1. That time has passed. So at the end of the skill, you are going to declare your skill is done. And they won't let you move on to skill 2 until you've ended the first one. They won't let you move on to skill 3 until you've ended the second one. And if you don't declare it, they're going to prompt you before you move on. You can make corrections up to the time you declare that your skill is done. So every skill that I demonstrate, you're going to see me say at the end, I'm going to think about my skill, make any corrections, and then tell the evaluator my skill is done. So you will hear me say that. And that means that I can't make any corrections after I declare that. Okay? At the end of the test, before I make corrections, it's a really good idea to go back and review that care plan. Remember, we have to follow the care plan, the whole care plan and I would go back and look at that care plan one more time and just make sure that I did the right thing at the right time on the right body part, and I followed that care plan exactly. Because if not, I'm going to correct it. So review that care plan one more time. My new videos actually have that. I display the care plan at the very end of the skill. I'm editing the new videos. We've got some new videos that we just taped, and I do all the editing. So I'm editing those videos now. And it's that's one of the things that I started doing is I put the care plan right on the screen when I'm saying I'll review the care plan, make any corrections, so you can see it right there. Anybody see my new videos yet? Anybody? No? Okay. You'll see some of them in here. I don't have all of them done yet, but you will see some. I'm working on it. My computer, I've got somebody working on my computer right now because it just died on me. All right, so most of the time you have to perform the steps. You can't just say correction I would have. Most of the time you'll have to perform them, but they'll let you know. They'll let you know. So let's see how we're going to get through this class. This is your syllabus. This is what you see up here. These are your books down here. This is our main website where the animated lessons and the skills videos live. When you're looking at the syllabus, there's a lot of information here, and we're going to cover all of it in 4 weeks. It's a lot. I know it's a lot, but I'm going to break it into bite-sized pieces for you so it shouldn't be so overwhelming. So if you look, we have columns and we have rows. And the rows are divided up into sections. So here you can see class 1 Monday. And you can see everything that we're learning in class on Monday. These are the skills. So we've learned skill rules. We've kind of touched on the opening, but I haven't taught it to you yet. We're going to learn the closing. We have to learn hand washing, and we're going to talk about indirect care. So we still have a long way to go, and I've only got 45 minutes. Over here, these are the lectures that I give in class. If for some reason I did not get to a lecture, you're probably going to want to read it on your own in the book. It gives you the page number. So we have talked about what to expect on the exam. We talked about delegation and liability. We've talked about patient considerations. You've learned about the testing care plans, and we learned about the principles. So all of those lectures have been done. So we have gotten a lot done today. Homework, we're going to get to that in a minute. And then over here is additional activities. These are things that I'm hoping to get to, but probably won't. So that's why it's over here with your homework. However, today, we went over the 5 key phrases. That's that little house, the CNA happy place. We did the care plan activity in class. We've talked about corrections, and we've talked about skills grading. So all of that's been done, and you've even seen the pages responsible for that. What we haven't talked about is warm, dark, and moist. That's going to go with hand washing that we're going to get to in just a minute. So this is how we're going to go through the program. Let's say for some reason that you're not able to make it next Monday. You would want to look at these skills and watch the videos for them to keep up. Better to come to the live stream or at least watch the replay of the live stream. One of those would be better. But if you can't do that for whatever reason, at least watch these videos to stay caught up. And I go by this pretty consistently. Every once in a while, I have to move something around if I get long-winded on something, but I'm pretty consistent on keeping to this schedule. So it allows you to kind of keep up and see what you're missing when you're not here. Now, this book is being loaned to you. It is not yours. Please do not write in it. Do not make notes in it. Do not highlight it. Do not let your dog eat it. This book is on loan to you. You're going to take it home and leave it there. It's used for homework. Remember, it's not my favorite book. It only talks about the care plan in one place. Not my favorite, but it does go over some foundational information that is important for you to know. So you're going to take it home and read it. Now, if you go back to that syllabus, you can see homework. It's going to tell you in the yellow textbook to read pages 1 through 20. You guys see that? 1 through 20. That's the yellow book. You're going to read those pages. Don't highlight, don't make notes, just read. It sounds like a lot, guys. It really isn't. The words are small. The writing is big. There's lots of pictures. It's not as bad as it sounds, but it is a textbook. It's kind of dry, kind of boring. I recommend that you only read in 10-minute blocks. Read something for 10 minutes and then go do something else, something mindless. Wash the dishes, walk the dog, play with the kids, do something that doesn't take a whole lot of brain power, because that allows your brain to digest what you just read. Have you ever read something, got all the way down the page and realized you have absolutely no idea what you just read? Yeah, that's because your brain is too busy trying to digest what it took in a while ago. It's like trying to eat a whole pumpkin pie after Thanksgiving dinner. It's too much. Your brain can't absorb it. So 10 minutes, go do something mindless. Let your brain catalog and then go back to the reading. Now, this is going to be even more important over the weekends because Wednesday, you're going to have 2 chapters. Over the weekends, you get 2 chapters. You got longer between classes. So you've got Wednesday, Thursday, Friday, Saturday, and Sunday to get 2 chapters out of the way. Don't sit down at 10 o'clock on Sunday night thinking you're going to get through all the stuff in 2 chapters. You're not going to retain any of it. Small, bite-sized pieces. Those of you who go on for nursing, that is so important. That will help you tremendously for those of you that are in the nursing program. Because there's a lot of information that you're going to have to go over. And if you're trying to cram it all in at one time, you're not going to retain any of it. All right. So once you have, Latchman says, thank you, Miss Patty, for your dedication and hard work teaching the CNA to help us pass your class. It is incredible, helpful. Please share online link to buy the quiz for the exam. Oh, well, thank you. Thank you very much. Super sweet. I don't have any quizzes for sale, but Jake will put the ebook in there for you that you can take a look at. And if you go to YouTube tomorrow at 11, you can participate in the game show as well. Oh, I saw some of your new videos are great. Oh, thank you, Jen. I appreciate that. Yeah, it's a whole new format. I'm super excited about it. Okay, so you're going to read chapter 1. You're going to go to page 181 in your white book. And this is going to help you decide whether you got the information out of chapter 1 that you needed. Just reading, you won't know where your gaps are. So if you take a test, it helps you identify whether you got the information you needed. Sound good? But just taking a test doesn't really help you unless you know whether you got the questions right or wrong. So if you go to the very last page, page 201, this is the answer key. So you'll read chapter 1, take the test on page 181, and then grade it with your answer key. Good? Good. What Jake is passing out right now are the worksheets. You're going to get one of these at the end of every class. Those of you who are joining us, if you go to flcnatraining.com, those worksheets are available online as well. You can download it, print it out. but this is a summary of everything we went over today. If you can answer these questions, that means that you paid attention today. Great job. You're going to get one of these for every class. So at the end, you're going to have 8 of these. If you fill them out when we have class, this is your study packet for testing. It's very quick, very concise. And I just started using these last year. The students are telling me that these make an incredible study packet for testing. So you'll get one of those for every class, but you can fill that out later. Let's go back to this so you know how to access the content. So now we're going to talk about the spiral book, and I'm going to kind of go through this a little bit quickly because I'm a little long-winded today. All right. So every skill that we're going to learn is going to have a page that looks like this in this book. Remember I said that you won't get much benefit out of these checklists. What you need is an RN to translate it for you. That's what I've done with this book. So if you go to page 52, this is how we start all skills. We start with a synopsis that kind of goes over a broad overview of the skill. So you'll see the name of the skill at the top. You'll see the principles that are involved in the skill, and they're going to be spelled out here. So you can see everything that we have to do to complete this skill properly. You'll see a short version of the skill at the top. That kind of assumes you know a thing or two. You'll see skill specific. So that's all the stuff on here that doesn't apply to the principal. Skill specific. And we have a video for this. Okay. Now down at the bottom, you're going to see test specific information. So this relates to just the test. This says somebody with your level of experience, which is none, should be able to do this skill in 5 minutes or less. You're going to do it on another testing student. That testing student will be in bed. This is a documentation skill. Normal is between 60 and 100. And if you can be off by 4 beats in either direction and still be accurate. So this is test-specific information. Now, not all skills are going to be done on another testing student. Some of them are just a little too personal. So we'll use the mannequin for those. There are 4 mannequin skills. So if you see a mannequin in that spot, it means we're going to be doing it on a mannequin. Most of the skills will start out with the patient in bed, but there are a few that have the patient starting in a chair. This is important because remember I said you're going to need to practice some of these things? If you get home and you're going to practice, you want to set this up just like the test. So you'd want to see, is this person going to start in a chair or a bed? That way you're practicing as you'll be testing. And charting or documentation is not required for all skills, just 4. Feeding, pulse, respirations, and drainage bag will require documentation. Now, in your book, if you turn to page 168 and 169, you'll see the documentation forms that are used by the state exam. So you can get familiar with them. You'll also see them in the lessons that require documentation. So here on page 53, you can see a small version of that documentation sheet and how to fill it out. Every lesson has review questions. If you can answer these questions, that tells you you've got a good grasp of the skill. Now, this page is specific to the checklist. So at the top of the page, here, you'll see the care plan. This is the care plan that you would see on the state exam, word for word, exactly the way the state exam is going to write it. Below that, At the very bottom of the page, you'll see the supplies that you're going to need to perform this skill. Now, you're not graded on supplies. There is no checkpoint that says got the right amount of supplies. You are not graded on supplies, but you are graded on what you do with the supplies. So if you don't get the right supplies, you're going to miss some checkpoints because you're not going to do the step. So supplies are graded indirectly. And then in the middle, you'll have step-by-step instructions. Now, the way that I wrote this, remember, we have our checklist that's written for RNs. I took this checklist, filtered it through my little RN brain, and wrote out step-by-step instructions for you to perform this skill and get all of these checkpoints achieved. Now, the new videos that I'm creating now, and I've got Pulse done, so you'll actually see this one. The new videos that I'm creating now has these checkpoints on the screen as I'm doing the step. So you can actually see when it says, ask the resident about preferences during care, how did I do that? So that will be on the screen when I'm doing that action. Okay, so it'll help you bring action and checkpoint a little closer together. We have the online course you guys are all going to be enrolled in later today. And that online course is going to give you additional information on all of these skills beyond what I'm giving you in class. And it's available for all of you guys that have enrolled. So let's talk about this opening. The opening is going to be done at the beginning of every skill. I have a video for it. Excuse me. And step-by-step instructions are located on page 31. But if you look at the banner right back there, the green one, what's your name? Caitlin. So the green banner behind Caitlin looks just like what you see on the screen here. And these are all of our steps of the opening. Every skill starts with the opening. Every opening starts with a knock because it's a graded checkpoint. So that's how we're going to start every skill. Then we have to do this in order. The order counts here. We're going to greet the resident and we're going to address them by name. For the test, we do not use ID bands. We address the patient by name. Just like when you go to the doctor's office, they come in and they call your name. Because if you are not the name they called, you're going to say, that's not me. The best way to identify a patient is with the patient, not an armband. Armbands can be wrong. So we're going to knock, greet the resident, and address them by name. Hi, Miss Jones. Easy. But then they need to know who we are. And I can't just walk in and say, hey, I'm Patty. So, are you Patty, the person that brings the cookies? I like that, Patty. Are you Patty, the person that brings the needles? Not so much. So we need to tell them not just our name, but also our title. So, hi, Miss Jones. My name is Patty, and I'm your CNA today. Good. Then we have to tell them what we're there to do. I'm here to insert name of skill here. Sure, I'm here to feed you a snack. I'm here to do some range of motion. I'm here to change your sheets. I'm here to give you a partial bed bath. I'm here to take your vital signs. I'm here to, what are we there to do? What is our task? Now, you can put it in your own words. You can also read it right off the care plan. Hi, Miss Jones. My name is Patty. I'm your CNA today, and I'm here to provide hand and nail care. Or you can read it right off of the care plan if you want to. If you're super nervous and your brain fled, that's okay. But then we want to ask, is that okay? We need permission from the patient. If we come over here and look at patient rights, your patient has the right to refuse treatment or care. A patient has the right to refuse anything at any time for any reason, and no means no. You can get halfway through a skill. If the patient says, stop, we're hands off. Now remember, our job as a CNA is to follow the care plan, or what do we do if we can't follow the care plan? Tell the nurse. So if the patient says stop, we're hands off, and who are we telling? The nurse. So all of those answers have already been given to you. Good? Make sense? Okay. Once we get permission, we're going to close our curtain. Now, let's talk about this curtain real quick. We did talk about the fact that the curtain will not go all the way around the bed for the test, but there's a couple other things about this curtain you need to know. Who touches this thing? Everybody. The patient will touch it. The patient's family and friends will touch it. The doctors and nurses and CNAs and dietary and phlebotomy and everybody else touches this curtain. Is this thing considered clean? No. In fact, it's only taken down physically, removed, and put in the laundry on average once a year. Housekeeping will spray it, but it's only laundered on average once a year. This thing cannot be considered clean at all. So if we're going to do a skill on this patient, do you think they want us to do it with clean hands or dirty hands? Clean. So we close the curtain, we have cootied up, and now we're going to go wash our hands to get rid of those cooties before we work on our patient. Those two things should be tied in your brain forever. If you touch the curtain, you wash your hands. Touch the curtain, wash your hands. As long as you have those two things tied in your brain forever, you'll never miss that step. Not clean. Needs clean hands. So there's got to be a step in between. Now, once we've closed the curtain and washed our hands, then we can go get our supplies. Don't get your supplies with dirty hands. Again, they want clean. Good? So our cardinal rule here, the one thing that we cannot forget, is this. Don't touch the resident until your hands are clean. Don't touch the resident until your hands are clean. Now, there's a lot of videos on YouTube, a ton of videos, and you're going to probably come across a million videos while you're, trying to get ready for the test, and that's fine. But if they touch that resident before their hands are clean when they're doing the demonstration, that is not accurate. This is a great way of figuring out whether it's accurate. This right here, this one step, can fail you. So let me explain why. In a hospital setting, in order to get a bed in a hospital, you've got to prove that you are sick enough to need that bed. You go to the ER, ER's job is to send you home, not to admit you. Their job is to stabilize you and get you out, not give you a bed. Make no mistake. In order to get a bed in a hospital, you've got to prove that you are sick enough to need that bed because there's 100 people behind you that need that bed. Make sense? So that means that we put the sickest people in our community in one place. And they all brought their germs with them. Now, this person is already fighting something. They're sick. That's why they're here. Their immune system currently busy. And I got you in the room next to them. You brought your germs with you. And it is very easy for your germs to get onto that patient because of me. Now, if we bring this patient a whole new set of germs to fight off, and their immune system is currently busy fighting something else, we can kill them. You guys see how serious that is? Now, that's in a hospital. Most people in the hospital don't go straight home. They go to a rehab or a nursing home first. You get strong enough before they can go home. That means all those same germs that were in the hospital are in the rehab and the nursing home. Starting to see that these are dangerous places for your patient who has a compromised immune system at the moment. That means that our infection control has got to be spot on all the time. These are not small rules. 1 out of every 25 people in a hospital setting will get an infection they did not come in with. Let me put that in a term that you can understand. Imagine riding a roller coaster. And as you get on the roller coaster and get all strapped in and it starts to move away, the guy running the roller coaster says, okay, well, one of you guys is going to fall out. Good luck. Hope it's not you. Bye. 1 out of every 25 patients gets an infection they did not come in with, and it is our fault because they're not going bed to bed. It's going to kill 1 out of every 12. That's scary, guys. And it's the only thing in our control. Okay? So these are not small rules. This, if you touch that patient before you've washed your hands, will fail you. And it should. It should. Because if I'm the body in the bed, I don't need anything extra. I don't want any additional pathogens. I'm fighting my own hard enough. So I told you guys you're all going to be enrolled in the online course. This is the lesson in the online course for the opening. I have a video on it that you can watch. That's the first thing that you'll see is that video. So you can click the video, you can play it through. And then once you do the video and you scroll down a little bit, you're going to see this activity. So this is a drag and drop sequencing activity. So it's got all the steps of the opening. This is everything we have to do with the opening. So it's going to ask you, what do we do first? This is all we have to do, but what do we do first? Well, the first thing we have to do is know what skill we're doing. So we're going to read the care plan. Remember, care plan is always first. So let's read that care plan. What's the next thing we want to do? Knock. Sure. So we'll put that one in there. Now what? Okay, so who wants to say your name and who wants to identify the patient? Okay. All right. That's the right one, is identify the patient. Because they have to know that we've got the right person. Then what do we want to do? Now say my name, say my name. Yeah, that's a whole song, right? All right, what do we want to do after that? Okay, not quite yet. They have to know what we're doing. Explain the task. And then once we get permission, what are we going to do? Close the curtain and then wash hands and then get our supplies. So let's see if we got it right. We're going to hit the check button at the bottom and we got a gold star. Congratulations, you did that right. So every lesson, every skills lesson in this online program is going to have a sequencing activity. So with this one, it's putting the steps of the opening in order. But as we get into skills, it's going to have the steps of pulse, put them in order. The steps of ambulate, put them in order. The steps of feeding, put them in order. And that way you can kind of try it to get the steps down before you start practicing it. And that will improve your confidence level when it's time to get up and practice. Good? Questions? So if every skill starts the same way with the opening, it's going to end the same way with the closing. Now on page 34, you'll see the steps of the closing. It's going to apply to all skills. And the closing is a little different than the opening. First of all, it's way longer. You can see all the steps there, way longer. I have a whole lesson here on page 35, and I actually have a little script for you. Right here is a little script. But there's 8 C's to the closing. Now, the thing about the closing that makes it different from the opening is the opening had to be done in order. Closing, we don't care about the order. Don't care. Other than the last 3. Last 3 steps have to be done in that order. But the rest of them, we don't care. Don't care. Any way you want to, don't care. So what are our steps? We have to make sure the patient is in a clean and safe environment. So make sure that the sheet is adjusted, that all the trash is off the table, that their trash can's not overflowing, the bed is in the low position. Make sure they're clean and safe. Patients rest better in a clean environment. We want to make sure they're comfortable. And remember, we had to say the word comfort. We talked about that. Are you comfortable? They need to hear that word. We're going to address preferences. Now, part of comfort is emotional comfort as well. Imagine this person, right? They don't have anything to keep them occupied. They're a little self-absorbed at the moment. Their family's not here, and TV is only going so far. So we have to make sure that their emotional needs are being met too. So we can offer them a crossword puzzle book, make sure they have their TV remote, ask if they want their cell phone charger. You know, we have to address things outside of just their physical needs as well. But for the test specifically, we're going to offer a magazine. And that's going to check that box. It says we understand the need for emotional entertainment as well. Good. That will keep your patients off the call light. Patients that have nothing to do will hit that call light and create something for you to do for their entertainment. That keeps them off the call light. So we'll offer them a magazine. We want to make sure they're covered. We looked at that earlier. It's a little uncomfortable for them to be uncovered. Clothing or sheet, doesn't matter, but make sure they're covered. Open the privacy curtain, give the patient the call light. So all of those things, clean and safe, comfortable, ask about a magazine, make sure they're covered. Here's your call light, open the curtain. I don't care how you do it. Don't care how it's done. Does not matter. But once you do all of those things, you have to go wash your hands because you have patient cooties all over your hands. You've done all kinds of stuff with this patient. Go wash those cooties off. Once you wash those cooties off, then you can pick up your pen and document if we need to. Don't pick that pen up with cootie covered hands. You pick that pen up with cootie covered hands and you've just contaminated your pen that's going back in your pocket and going home with you at the end of the day. Remember, these are not Walmart germs. These are germs that are big enough and bad enough to make the patient not be in their home. You don't want those germs in yours. Clean hands to touch the pen. But we have a principle that is super important. We have to end skill with clean hands, right? So remember with the opening, we can't touch the patient until we have clean hands. Well, at the end of the skill, it's the last thing we do. We end skill with clean hands. So if we document, we have to wash our hands again to end skill with clean hands. Now, once you've done that final hand washing, don't come back to this patient because you're going to cootie right back up. So once you wash your hands the last time, you're done. Don't go back to that patient. If you do, what would you need to do? Wash your hands again. So if you forget to give them their call light, you realize at the very end you didn't give them their call light, you reach over to give them their call light, make sure you wash your hands again. Good? Now I have a lesson on this as well. Again, there's a video you can watch. You will all have access to this later today. But this is not a sequencing activity because I told you the sequence of this doesn't matter. Nobody cares. What it's going to ask you to do is click on anything that we have to do during the closing, like make sure the trash is picked up, bed is in the low position, document, give them their call light, close the privacy curtain, ask if they're comfortable, wash our hands. So it's asking you to choose all of those actions. Sure.
They say the bed being in the lowest position, but when we go to take the skills assessment, are they going to have like side rails that need to be like up or down?
We're going to talk about side rails a little bit later in the program. Really in week 2 is where I get into side rails. We'll talk about it a little bit on Wednesday, but week 2 is when I really get into it. No, side rails are not graded on the state exam. You cannot use them for safety. But I'm going to teach you how to keep our patients safe without them. Side rails are considered a restraint. All right, so page 44, we're going to learn how to wash our hands. If you look at this page, you'll see all of the steps involved in hand washing. This is the actual checklist that's used for hand washing. Short version here, and our big point here is that we have to provide at least 20 seconds of friction. So that means we got to rub with soap for 20 seconds. Step-by-step instructions are on page 45. Tells you exactly how to wash your hands. And unfortunately, I do have this video done, the new video, but I don't have it downloaded. And my computer, I couldn't download anything because it's dead at the moment. So I'm going to show you the older video, but if you go on to our YouTube channel, you can see the newest one. And the newest one have all of those checkpoints right on the screen. But let me show you this video. It will take about a minute, and it's going to go over exactly how to, exactly how to wash your hands. Ow.
When you approach the sink, you can touch the faucet with your unclean hands because the faucet is considered the dirtiest object in the bathroom. Adjust the water temperature for comfort and wet your hands. Apply soap and rub all surfaces of your hands vigorously, focusing on the front and back of your hands and in between all fingers. Circle the top of your wrists as well. Friction is the key to removing all pathogens from the surface of your skin. Friction should be applied for at least 20 seconds to be effective. After washing with friction, the nails must be cleaned. Run one thumb down the length of each nail, starting at the cuticle and moving toward the end of the nail. Repeat with all fingers of both hands. Then clean under your nails by scrubbing the underside of your nails along your palm to remove debris. Carefully rinse your hands under the stream of water with your fingertips pointing downwards, taking care not to touch the inside of the sink or the faucet. Tap your fingers together to ensure that all water droplets remain in the sink. Take paper towels from the paper towel dispenser and dry all surfaces of your hands, the front, back, between your fingers, and your wrists, taking care not to allow the paper towels to touch the unwashed areas of your lower arms. Throw these paper towels directly into the trash bin. Finally, take a clean, dry paper towel to turn the faucet off, because wet paper towels may rip and recontaminate your hands.
Okay. Ooh, All right. So that video is up on our website. You can rewatch it, but we'll be going into hand washing over and over and over again in the program because we're going to wash our hands like a million times. Invest in good lotion because you will have a lot of hand washing as you go through your career. So any questions on how to wash your hands? We have to get a good lather. You want to make sure that when you're washing your hands, you're getting all surfaces really well, and you have to provide friction for at least 20 seconds. Don't sing a song. When you're nervous, singing speeds up. It's not an effective way of gauging time. For the test, there's a clock right above the sink. Use that for your timing. 20 seconds of friction before moving to your nails. Now, we have to keep our eye open. Guys, I told you I was going to talk nonstop till 1. We have to keep our eyes open in healthcare for environments that are warm, dark, and moist, because that is the ideal breeding environment for pathogens. Bathrooms are usually warm. We keep it 1 or 2 degrees warmer than other areas of the house because we don't like to be chilled when we get out of the shower. Facilities are the same way. Bathrooms are usually a little warmer. Bathrooms are usually dark because we're trained, turn the lights off when you're not in the bathroom. When you shake your hands in a bathroom where we already have warm and we already have dark, when you shake your hands, you create little droplets of moisture all over that environment. And we know bacteria live in the bathroom. So we're creating little pools for those bacteria to proliferate, to grow. And you're going to walk through those and take those bacteria all over your environment, your work environment, and that they will stay on your shoes and go home with you at the end of the day. So that's why we do this. When you tap, it keeps the moisture confined to the sink. So we have a controlled environment. Make sense? That's why it's better to tap in healthcare than shake. It's not a graded checkpoint, but it's something you probably should start getting used to because most facilities will require that. Yeah, we already know that. So the faucet handles are the dirtiest thing in the bathroom, but you can touch them to turn the water on. Dirty hands can touch a dirty faucet. That's fine. We're going to wet our hands. Soap does not distribute well on dry skin. So wet your hands. Get some soap. Lathering is a graded checkpoint, so get a lot of soap. And you're going to rub for at least 20 seconds. After rubbing, you can move on to your nails. You're going to rub your wrists, the back of your hand, in between your fingers, and between the thumb and index finger, all areas, paying special attention to the areas in red here. The back of the thumb gets missed a lot. In between these two fingers gets missed a lot. And this part, these creases get missed a lot. What really surprised me were the tips of the fingers, not on this side, but on this side. Most people don't pay attention to their fingernails when they wash their hands, and yet the fingernails are what we do everything with. So pay attention to those nails when you're washing your hands. Good? Okay, don't sing. 20 seconds is 20 seconds on the clock, not through song. Go down each one of your nails with your thumb. That gets your cuticles and cleans under the nails by rubbing them in a circle on your hand, and then rinse. But when you rinse, don't touch that faucet or the inside of the sink. They're not clean. We don't want to recontaminate. We're going to tap, and then we'll get some paper towels to dry. Now, I'm going to tell you, I got 7 minutes. Okay. You are going to see, especially on testing day, when you are in that room with 7 strangers, you have nothing to talk about, no phones to distract you. So you're probably going to start to talk to each other like, oh my gosh, I'm so nervous about this test. And you start comparing notes. And the conversation goes something like this. I am so scared I'm going to fail hand washing. And you're going to say, hand washing? That's like the easiest skill. And another person will say, no, it's not, because I'm afraid I'm not going to get enough paper towels. And you're going to go, paper towels? What does that have to do with anything? Oh, well, my teacher told me that you needed 12 paper towels to dry your hands. And you're going to be like, 12 paper towels? My teacher didn't say anything about 12 paper towels. So now automatically you're starting to stress out because we don't know who's right. So your anxiety just went through the roof. And somebody's going to say, oh, yeah, I heard you have to do each finger individually. And then you have to do the palms of the hands and then the backs of the hands. And somebody else is going to say, I didn't learn that. And it will really ramp up. Be careful about talking about skills in the waiting room. That's not the time to be discussing your skills. Now, you're being taught the right way, and I'm proving it by putting the checkpoints on the screen. I know you're being taught the right way. Our students pass. It's not a big deal. But during the test, If you're getting input from other people, you can start to doubt that what you were taught is real and right. And that'll affect your confidence. I don't want you to get into that trap. Don't try to help anybody else either. The time for them to learn was before the test, not during. After the test, go teach everybody. Everybody needs to know these skills. Teach the world, but not on testing day. Don't try to make friends. It'll stress you and them out. Does not matter how many paper towels you use. I promise. No checkpoint. All right, just don't touch anything you didn't wash. Clean paper towels on clean skin. That makes sense, right? And then we're going to throw those paper towels away, but that water is still running. You don't want to turn that faucet off with that paper towel because wet paper towels tend to rip. Remember, the faucet is dirty. And if that paper towel rips and you contaminate your hands, you may not know it, but you're going to take that contamination to the patient. So clean, dry paper towel to turn that faucet off. Oops. Okay. All right. So I have a sequencing activity on the website for this, on the course. If you click the button at the top, it'll bring up the actual checklist so you have access to it. You can watch the video that we just watched. It's on the screen. And then we have a sequencing activity. So our first step is to turn the water on. Then we're going to wet our hands. We're going to apply soap. After we apply soap, we'll start rubbing together and lather all surfaces. And we're going to keep rubbing for at least 20 seconds. Then we're going to move on to our nails. We'll rinse all surfaces. We'll turn the water, or dry our hands, throw that paper towel away and turn the water off with another paper towel. We'll hit check and get our yellow star. Good job. Page 46 tells you why you shouldn't sing. Just remember, you shouldn't sing. Clocks. All right, so indirect care. I got 3 minutes. Stay with me. Indirect care. Go to page 28. Let's talk about indirect care. Indirect care can be summed up with how you treat the patient while you're performing skills. And it's graded on the state exam. It is absolutely graded on the state exam. So we're going to pay attention to a lot of what we call nonverbal cues when we're doing our skills. But the best way for me to sum this up is if you switched places with the patient, if you were all of a sudden the one in the bed, how would you want to be treated? If you keep that in mind as you're doing the skills, you will treat the patients the right way. Okay. So I always try to think, okay, if I were the one in the bed, how would I want this done? How would I want to be talked to? How much explanation would I want to have? But indirect care can really be summed up with your eye contact, tone of voice, rate of speech, how quickly you talk. Remember that the faster you talk and the more medical terms you use, the more confused your patient is going to be. Confused patients get combative because confusion leads to fear. So slow your speech down. Make eye contact. Make sure you're using a good tone of voice. A lot of times it's not what we say, it's how we say it. Pay attention to your body language. Body language plays a big part in this. If this is my patient and I'm talking to her, but I'm facing this way, that tells her that she is not my focus. She is a byproduct of what I'm doing. This is not good body nonverbal cues. So body language. Provide explanations. Watch your own posture. This looks lazy. Looks like I don't care. This looks like I have pride in what I do. It makes me look confident, and it gives that patient a sense of competency that I need for them to trust me. So watch your posture as well and your overall attitude. I'm going to say one more thing about posture. I might keep you like 2 minutes late, so bear with me real quick. You guys need to be paid more. CNAs need to be paid more. The pay scale for CNAs is just horribly low. But a lot of this is in your hands, and CNAs don't realize this. When CNAs are on the job and they don't act professional, they aren't seen as professional. And if you want professional wages, you must act professional to be seen as a professional and get professional wages. So when CNAs show up for work and they're in wrinkled scrubs that don't match and have holes and stains and tears, when they don't care about the words that they're choosing, when they treat their coworkers poorly, when they don't work as part of a team, all of that screams that you are not professional. And when you're not professional, you're not going to get professional wages. And until the CNA industry as a whole figures this out, the wages are not going to increase. They're just not. Why would they? So a big part of elevating the industry as a whole is to make sure that you're doing your part to uphold the professionalism. And that's going to come through all of those nonverbal cues. Does that make sense? I want you to be paid more. But there's an individual responsibility to make that happen. So to review homework on your syllabus, up at the very top of the page, you can see that you're going to read pages 1 to 20 in the yellow textbook. In the white book or spiral book, you're going to take the test on page 181, and you're going to grade that using the answer key at the very back of that book. Please do not write in the yellow book. Take it home, leave it there. It's only for homework reading. You'll bring it back to me on the last day, but you don't need to bring it back and forth every class. All right. This just goes through all that. Nope, that's not your. Okay. This is your review sheet that you were given. Does anybody have any questions for me? I know I'm 2 minutes over. I'm sorry, guys. Does anybody have any questions for me?
The unit test, do you have to take it on the spiral book or you take it in class?
The unit test is a spiral book, and that's more for you. I don't take the scores on that. That's basically for you to make sure that you're on track and getting the information that you need. So please remember, you will get a wrap-up email from me in just a little bit, and you will be enrolled in the online course, so you'll get an email about that as well. Is everybody okay with the class today? Did I overwhelm anybody? Am I going too fast? This is your class. If you're struggling at all, please come see me. I don't want anybody to drop because you feel overwhelmed. I want you guys to come back. It's your class. Okay? Is everybody happy you came? All right. You guys have a fantastic day. Remember, the game show's tomorrow at 11. Join us if you can, or watch the replays. It'll help you. And I'll see you in class on Wednesday. Thank you guys all for coming. Have a fantastic day. Those of you joining virtually, thank you so much for hanging in there. I know I'm a few minutes late. We will see you for the game show tomorrow at 11 a.m. Eastern. Hope to see you there. Until next time, happy caregiving. Bye.